Hey, Rico, will you say something so I can check my audio?
Can you hear me?
Can you hear me?
Can you hear me? Can you hear me?
Okay, I can't hear you.
Okay, that means.
I can hear you.
Hey, Ms. Val, how you doing?
Very well. How are you?
I'm doing very well as well.
That's awesome. Awesome. We're all managing in our pandemic places.
Yeah, it is. It's a new world, huh?
It is indeed.
Yeah.
And I hope that it won't be forever. So Rhonda's not hearing us, but we can hear her.
Right, because I can hear her.
Yeah. She's going to have to go in her settings in the back.
Yeah. So Rhonda, you still can't hear me?
Hmm.
Okay, say something again. I think we got it fixed.
Hello, hello, hello.
Hey, okay, I can hear now.
Can you hear me?
I can hear you. We're good. And
Wait.
5 minutes to go. Perfect. Thank you, guys.
Nothing like a little stress to get your heart going.
Yep, make sure that blood's flowing.
Good morning.
Good morning.
Good morning. We're so excited you could join us.
Thank you for inviting me.
It's nice to finally, virtually meet you.
I know, right? We've been talking so much. I feel like I know you.
Yeah, right? It's always nice to finally get to talk to somebody.
Yes, thank you all.
Yeah, so you haven't had a chance to meet me, but I'm actually from Memphis. Really like looking at your profile. You know what I mean?
Representing
all
the
right.
Tennessee, yes.
Yeah, I know a little something about that place.
Yes. I've only been here 20 years though. I'm actually from East St. Louis, Missouri, and also, Illinois and Arkansas.
So it's so funny because I spent the beginning of my life in Tennessee for the first 28 years. So we've been in St. Louis before, in the Boot Hill. So we kind of did the opposite, right?
So y'all went back the other way. We came back.
Right.
Yes. Well, it's nice to meet you.
You as well.
Y'all excuse me for a minute. I'm trying to navigate which computer I want to use.
Okay.
Rhonda, are we still on the same times? You can just put your thumb up if that's true. Okay, great, thank you.
Hey, Rhonda, tell me when.
You're good to go.
You ready to start? Cool. Good morning, everyone.
Good morning.
My name is Rico Johnson. On behalf
Hi.
on behalf of the Missouri Regional Consortium, it is our honor to welcome you to the 2020 Boot Hill Health Alliance Virtual Diabetes Learnative Collaborative Workshop. Today, we have the opportunity to learn about and discuss diabetes and the ways to increase awareness and to prevent and control diabetes. We look forward to a great day of information and resource sharing regarding diabetes prevention. We give a special thanks to all of today's speakers who will share with us resources, achievements, and setbacks in regards to diabetes. We'd like to thank all of the partners within the Boot Hill Health Alliance for their commitment, dedication, and hard work to make both programs successful. Lastly, we would like to thank everyone. We would like to thank each and every one of you so much for attending today's diabetes workshop. It is our hope that today's workshop will be both informative and rewarding to all participants. So now I will pass on to Rhonda. Bye.
Okay, guys, I know Rico's audio was cutting in and out a little bit. Can you let me know if you can hear me okay?
Yes, I can hear you, and I heard him.
Okay, so I'm not cutting out?
No, you're not cutting out.
No.
Okay, good deal. I just wanted to make sure. Okay, thank you so much, Rico. So before we get started, we want to go over a couple housekeeping rules. The meeting is being recorded, and we will be emailing the recording to everyone by 5 p.m. on November 23rd. We have muted everybody upon default to limit disruptions, and we will also work diligently to try to make sure that everybody stays muted by monitoring the voices on the participant screen. When the presenters are sharing their screen, please write in the chat box and let us know if you're experiencing any technical difficulties. We're going to do our best to monitor that and try to fix those as quickly as possible. You're welcome to use the chat box throughout also to write questions, and at the end of the presentations, we will facilitate those questions, and any question that is not able to be answered due to time, we will ask the speaker to write back in the chat box. And then with that being said, I'm going to switch screens here. Okay. Can everybody see that? You just want to do a thumbs up or something, that'll be totally fine.
Yes.
Okay, good deal. Okay, so my name is Rhonda Diebold, and I am the Community Outreach Specialist with the Boot Hill Health Alliance program here at MBRC. I want to tell you guys a little bit about the program and then give a couple of the statistics here that we do have in the Boot Hill, and then also some of the statistics for our program and different success stories that we have had. So the Boot Hill Health Alliance is a group of network of healthcare providers, and we've all come together with the same goal in mind. We all want to improve the well-being of the residents in the Boot Hill. Our funding is through the HRSA Rural Health Network Development Grant, and we have been funded from July 2017 through June 2021 as MBRC is the grantee. Our target population are African Americans residing in the Missouri Boot Hill who are obese or have been diagnosed with diabetes or are at risk for developing diabetes. And so, as you can see in these charts that I have over here, it is very evident of the disparities that exist between white and African American. So our goal is to provide the education in the community so that we can decrease those disparities. So our mission to decrease the disparities in health outcomes, improve the well-being of the residents of the Missouri Boot Hill by overcoming the health disparities in obesity and diabetes. And then as you can see, our service region, so we serve 5 different counties, Dunklin, Pemiscot, Scott, New Madrid, and Mississippi. And for the health outcomes, you can also see over here, so we have some of the worst health outcomes in Missouri.
It is very hard to hear you with there's 2 that are cutting in and out on you that are not muted. I'm so sorry. It's not you.
Okay, no, thank you.
No, it's okay. I know that sometimes we hit the button on accident. It's just very hard to hear you. I'm so sorry.
Okay, give us just a second. I'm going to ask everybody to mute yourselves again. It's not showing us who isn't muted, but I can hear the background sound also.
Rhonda, it's the 481 number.
Okay, thank you, Mark. I apologize, guys. Try this again. Okay, I think I fixed the problem. If you guys hear it again, just let me know. Can you hear me okay, though? We can just do some thumbs
Yes,
up.
I can hear you.
Okay.
I can hear you.
Good. Thank you. Okay, so as I was saying, our service region, we have these 5 counties, Dunklin, Pemiscot, Scott, New Madrid, and Mississippi, and we do have the worst health outcomes in the state of Missouri. Some more statistics for Missouri. So you can see here for Missouri, the mortality rate for diabetes for African American to white is significantly higher. And then also on this graph, you can see that while the trend for African American is going down, which is great, it is still statistically significantly higher than that of the white individuals.
It's the 573
Okay.
number again.
Oh, I will mute everybody again.
It is not your fault. Like you said, is everybody
No,
good?
it's okay.
You did, and then it happened again.
We had this at another workshop too. There's something about the phone line that makes it more difficult to keep muted.
It does.
Okay, I've muted everybody again. The specific goals for the program: decrease risk factors for diabetes and obesity, decrease the disparities in obesity rates and diabetes control, improve the overall mental health of individuals diagnosed with diabetes and obesity, implement a community-driven approach to preventing and managing diabetes and obesity. Everything we do is community-driven. We want to make sure that we are meeting the community where they're at and giving them what they need. So the different services that we have provided prior to COVID-19, things look a little different now, were health education, health screening, support groups, increased exercise opportunities, and community engagement. Our current partners with the Boot Hill Health Alliance program are MBRC, the Boot Hill Healthy Start program, NHS distributors, the Southeast Missouri Rural Minority Health Coalition, Community Action Network, Alzheimer's Association, and Heartland Moves. Okay, so like I said, that was what we were doing prior to COVID-19. COVID has had an impact on the program. However, we have been able to continue our partnerships. We work closely with NHS to provide education in the community utilizing social media and other resources that are virtual so that we're not meeting in class. We have suspended all of our in-person classes. The partners do play a key role in providing that education. We are also doing like the diabetes workshop virtually. We typically have this event in person. We are continuing to follow up with our participants using the phone. And then we are also developing an education module that we can post on the MBRC website that will be accessible to the community. Okay, so this is just a few things that some of our participants have said, and then I've also got a video at the end that I want to show. So one thing that I learned during class is that I did not know before was how to eat right and how to take care of yourself. A change I have made as a result of participating in the Power to Prevent class is portion control. And then we asked some individuals if there was one thing that they could tell somebody else that would be thinking about taking the class, what would it be? And so one of them said it's a good thing to do and it's fun. Do like she tells you and it will help you and your sugar. It is and was formative. It was well worth the time. And to me, that's very impactful. Our classes are 8 weeks. And so that can be a big time commitment for our participants. So it's good for them to know that it's worth the time and for us to know that they feel that it's worth the time. And then also it would be helpful for you to know things about your health and then be open to learning. Some other success that we've had 310 individuals total that have completed the 8-week Power to Prevent class. The data that we collect using a pre and post survey shows an increase in knowledge after the 8-week Power to Prevent class. And you can see that right here on this chart. This is pre-program knowledge and then post-program. And then over here, I broke it down by question. So each of these questions asks them like, what do you know about diabetes and coping with stress? What do you know about the plate method? Just different things that we're gonna learn throughout class. And so you can see the line on the bottom pre-class and then the line on top post-class. Our data also shows that 33% of our participants who provided a baseline weight and height and then a post-class baseline height and weight have lowered their BMI. And then overall through community events and meetings and workshops, we have been able to provide education to over 2,000 individuals in the community. And then this is just a couple pictures and I am going to play the video for you guys.
It's very hard to follow you with this noise in the background. It is not your fault. I'm so sorry. That number just keeps unmuting every time you do it.
Okay, so I have, we're gonna have the administrative assistant call that number individually and see if we can get that figured out. I'm sorry.
I'm just trying to follow you because you have a lot of good information and I'm so sorry.
Yes, and I will be sending out my PowerPoints and everything. I know it won't be exactly the same as hearing me talk, but we are sending that information out to everybody as well.
I appreciate it so much. Thank you so much.
You're welcome. Oh. We're trying to stop that noise before I start my video so that you guys can hear it. Can you guys still hear the background noise? Or is it better?
No, we're going to hear it because, of course, the Zoom is picking up any new sound.
Yes.
So whoever has 573-481-6569, your phone is on and you're moving around in the background. So if you cannot mute it, then try not to move. There's muted again.
Okay, I just muted it again.
Oh, well.
Yeah.
Thank you very much.
You're welcome. It keeps unmuting. Hopefully it'll stay muted through the video and then we can get it permanently fixed. Okay, I'm gonna start this and see if you guys can hear it and if it works out fine.
Because knowledge, when you know, it helps you. When you don't know, it destroys you. So I got knowledge going through this class, how to help myself.
I think for the class because I'm more aware of it and I've been to eat better or do things well to try and help prevent from it occurring. So I learned a lot from the class and I'm just thankful for the class.
I enjoyed this class, learned about diabetes because my husband became diabetic in 2004. And so it was still a lot of things that I didn't know that I learned in this class. And I thank God for it.
I took this class to learn about diabetes, awareness, and prevention because there are so many distant relatives that have had amputations, that have lost their lives to diabetes and didn't know they had it until it was too late.
Diabetes are more likely to become depressed.
That's not all that I learned, but we learned a whole lot, in the class. And it was good, for people who do have who is a diabetic.
And I have seen the good and the bad with, dealing with diabetes in my family.
Take a diabetes class. And I said, well, I will when I get a chance. As it come along, I found out that the way I was eating the wrong way.
I just want to say that I didn't know a lot about diabetes when I first started. I honestly knew a few things, and I say it's important to get educated about it because I actually have family and even some friends that are my age that have it. So now I've learned some stuff about it, and I can be able to help them or tell them some stuff that might can help assist them, something that they didn't know.
Move for me. I'm going to commit to it, and I'm going to commit to it to the end because I love living. And once you come to that, you love living, you do the things and eat right to be a better person.
Okay. I hope you guys were able to hear that okay and see it. That was just a very brief couple snippets. The impact that these individuals have had in the community and the commitment they've had to learning. There isn't enough time in the day for me to show you everything. So that was just a couple things that I selected, and I hope you enjoyed it. Thank you again for being here today. We are going to go into our other presenters. I will check the chat box if there's any questions or anything for me. I will reply to that. But with that being said, we are going to introduce our next presenter, Miss Valda Ford, and she is going to be talking to us about why our environment matters. So, Miss Valda, whenever you're ready to screen share. Oh.
I'm going to start without the screen share. I'll pull it up.
Okay, perfect.
All right.
Before we get started, Ms. Valda, if for whatever reason I have to go and mute everybody, I'll let you know so that you can turn around and unmute yourself, okay?
Okay. Well,
okay,
I'll go ahead, since we're having technical issues, I'll go ahead and share, and I'll just take it down later in case it's not, so that we'll know ahead of time. All right. All right. Can you see my video?
Looks great.
PowerPoint? Great. Why your environment matters is what we're going to talk about today. The Boot Hill Health Alliance has been working so hard to make sure that all of you know as much as you can about diabetes. Diabetes is one of those things that if we have the ability to really let ourselves be educated, then we'll have the opportunity to do a better job of taking care of ourselves and taking care of our families. I know that we're zooming in right now and there's not very much that we can do about responding the way we would like, but if you can give reactions, show me how many of you know someone who has diabetes. Yes, and if you don't, you will. And the reason why is that diabetes is very pervasive here in the United States. We have had people having diabetes from the time, all the time that I've known and all the time that the history of medicine has shown diabetes, knowing specifically what it is or showing those types of symptoms. And today we'll find out why your environment impacts your diabetes. According to Florence Nightingale, who was considered to be the person who exemplified nursing and who modern nursing is modeled after, it is cheaper to promote health than to maintain people in illness. For those of you who have diabetes or any type of chronic illness, then you know that it's not cheap to keep up with what's going on. Whether it means that you have to go to a lot of doctor's appointments, whether you have to have a lot of prescription meds. At one point in the early 2000s, I was pretty sick and I didn't know what was going on. But by the time I'd been to 10 or 12 specialists and still didn't know what was going on, I was taking about 12 different medications a day. Now that in and of itself was horrifying to me as a registered nurse and a public health expert to just know that at that young, tender age, I was taking a dozen pills a day. And worse than that, my co-pays for those medications meant that I was putting out between $400 and $500 a month just to be able to use those medications. So certainly if I was healthy, that cost could have gone to something else. And then what does the environment have to do? When we look at the environment, our goal is to maintain living conditions that nurture, support, and encourage our best life. And the ways we look at them, whether it's psychological, physical, or community, when we think about psychological, then we think about what's going on in our minds and in our hearts. And physical is about the actual things going on inside our body. And what is the environment like out and about? Right now, we have to worry about any number of things, including the weather is getting colder. We may or may not have the kind of environment that we can get out and walk around easily, whether they're walking trails, whether it's easy to get around, or it may be that we're in an isolated situation, and with the current conditions like COVID-19, it may really affect us negatively. There are many parts of whether or not we're healthy. So we have to decide what health is. Health is not just the absence of illness. It is the ability to live well. And these things are part of what it takes to be healthy. Do you have access to health care? After many years of working with MBRC and all of you in the Boot Hill, I know that access to care is not something that's easy to have. You may live a long way from the nearest healthcare facility, or you may not feel like it's as welcoming to you as you would like for it to be. The other thing is, what are your health behaviors? Are you taking risk with your health by using tobacco, not paying attention to what you eat, not exercising, overusing alcohol, or having unsafe sex? Socioeconomically, right now, the entire country, the environment that is the United States, is totally stressed out because of the virus, because of job losses, because of changes in our way of being and doing. And then, of course, there's a physical environment. Do you live close to a park? Do you have the opportunity to get out and about safely? All of these things go into whether or not you are healthy, and all of these are a part of your environment. When we talk about diabetes, I'm going to make the assumption that everyone here knows about diabetes, but I won't assume that you know everything. So please forgive me if I'm going into too much depth. Diabetes, I think we have large numbers of people in the United States with diabetes. According to the Centers for Disease Control and the World Health Organization, we have 34.2 million people in the United States, 1 out of 10. We have approximately 340 million people living in the US. So 34.2 million have diabetes, 1 in 10. If we were in a room with 500 of us, that would mean 50 people in that room would most likely have diabetes. Especially the farther up in age you go, the more likely that is to be the case. People who are most likely to be diagnosed with diabetes are between 45 and 65 years of age. And then you have another 88 million people who are pre-diabetic. And that means that there is a change in what's going on in your body, but not yet into what's called diabetes. And let's discuss that a little more. When we look at what is diabetes, it's a chronic, long-lasting health condition that affects how your body turns food into energy. I hear people say all the time, well, my sugar's off, or I got a little sugar, or my daddy has the sugar, or things like that. And it leads people to think that it's just about eating sugar. And it's not just sugar, cane sugar, and those type of things. It is the fact that your body turns what you eat into sugars to be broken down. But if you have the right amount and if your body is able to manage it, then it's used for energy. Now, there are different types of diabetes. There's type 1. At one point, type 1 was called juvenile diabetes. That is because it is something that we might see in children, or was usually first seen in children. Type 1 diabetes is a situation where there is no insulin being made, or so little as to be considered not working. And that person who has type 1 diabetes is going to have supplemental insulin to live. Then there's type 2, which formerly was called adult onset diabetes, because we typically would see it in people who were older, who were overweight, who were in less good shape. But now, unfortunately, over the last 1 or 2 decades, as we've had more obesity as part of our lifestyle, less activity, we are finding that type 2 is seen in every age as well. We very frequently can see children in elementary school and middle school who have type 2 diabetes. With type 2 diabetes, we'll discuss this a little more in a second, but it means that you have insulin, your body may be resistant to it. And then there's gestational diabetes. Since Missouri Boot Hill Regional Consortium is very interested in looking at the health of all, and particularly looking at infant mortality reduction, many of you know a lot about what goes on when you're pregnant, but gestational diabetes is a situation where a woman will not have diabetes before she's pregnant, but because of her hormonal changes may become diabetic during pregnancy. What's really important here is that if you find out as early as possible, then your obstetrician can help manage that. Because having gestational diabetes gives you a 30% increased risk of having diabetes later on. Now, many people who have diabetes don't know it, but sometimes you can get these symptoms that will help you know it. Like you're going to the bathroom a lot, you're thirsty, you're hungry, you're having blurred vision, numb, tingling hands and feet, you're tired, dry skin, sores that won't heal. There are any number of signs that the body is trying to give us to say, hey, please help me. And we may just ignore them. So it is very important that if you're starting to have any of these symptoms and they're more than just a day or two, make sure that you have a good relationship with your healthcare provider so you can find out what's going on, because the earlier you know about diabetes, the less damage it will do to your body. Now, and why does that happen? I have a slide for that in a minute, but today, just today, I heard this. This is from Dr. Robert Gabay, who's from the American Diabetes Association. He's the Chief Medical and Chief Science Officer. And he said that with COVID-19, which is our environment right now, whether or not you believe it, it's there. It doesn't care if you believe in it. There are 240,000 people who have died from this in the United States alone. If you look at all the people who have died from COVID-19, 40% have diabetes. Now, he also said the complications from the virus can be managed if people maintain their blood sugar properly. Here is yet another reason to know if you have diabetes and to make sure you are managing your blood sugar. When we look at, yes.
I'm going, so is it unmuted again? I'm going to mute everybody and take off the option for you guys to unmute yourselves and see if that fixes it. And then I will unmute you, okay?
Okay.
Okay, it's asking to unmute you. I don't know if you can see it on your end. It may not let me do it that way.
Yeah. Okay.
Okay, yay.
Yeah.
I can hear you. Okay, thank you. Hopefully that fixed it for good this time. So every speaker, when they go, I'll just ask them to unmute themselves so that it keeps everybody muted, hopefully.
Okay, and it just has to be done when there's no screen share, because they wouldn't let me, I had to stop the screen share, but that's all right.
Okay.
No. Okay. We're going to look at type 2 diabetes. One thing for certain, if you have type 1 diabetes and you do not take care of it, you will be in a world of hurt, basically. And so I'm going to assume that if you have type 1, you know it. If you're a parent of a child who's had any of those symptoms or you've had them, then get to see a doctor. So when we're looking at diabetes in general, the important thing is insulin. As we spoke about earlier, insulin is made in the pancreas in specialized cells called the islets of Langerhans. And that's probably not ever going to matter to you unless you're on Jeopardy. And if you're on Jeopardy and you win $100,000, then just give a sister a cut. That's all I can say. But what is insulin? Insulin is a hormone that acts like a key. What you're looking at now is a cross section of a blood vessel. And when you see those little cubes over top on the left, that's supposed to look like sugar, even though it's not just cane sugar, but that's just, in your mind, that's sugar. And then when you look in that same blood vessel on the left-hand side, you see little bits of it in the blood vessel, and then below it going into the cell. And that looks like it's charging up. Can you see it? Now on the right-hand side, as you might see, there are more white crystals inside the blood vessel. And then as you look at the cell at the bottom, you can see that the sugar is going there, but it's either bouncing off or not getting in at all. So when that happens, you don't feel as good as you might. Now, let me try to use it in a different way. All of us have cell phones, or we have some type of device, and every one of them requires charging. When you plug your phone in from the wall, there's plenty of power coming from the wall, and the charge goes into your phone. And then it just keeps going, keeps going, keeps going until it's fully charged. And when your phone is fully charged, you can do anything you want. You can get out, you can do Facebook Live, you can record everything, you can do TikTok videos, or you can send all sorts of text and emails all day long. But when there's no power there, like if you have an older phone and the charge isn't working. So even though you plug it in every night, maybe in the morning it's fully charged, but instead of the charge lasting all day long, it's only lasting for 6 hours or 8 hours, where it used to last a full 24 hours and maybe even into the next day. That's how your body is dealing with the lack of energy, because the blood sugar cannot get into the cells in order to give you energy. So think about that again. Your body is like a cell phone. And when your body is working really well and all the energy is going into it like it should, then no problem. You can get up, you can go, you can do everything that you need to do for the day. You have good energy, you have your mental status is good, you're happy. And then when you're feeling tired and drawn and tired, then you can't get it fixed. Even if you restart it and restart it and restart it, you're not getting more energy because there's something wrong. And this is what happens when you don't have enough insulin to get the power to the cell. Now, conversely, if your blood sugar is out of control, that's a big problem. When your blood sugar is working like it should, like here, when you just have a little bit of blood sugar in the vessel, then that's the equivalent of if you've ever seen motor oil. Many of you have seen motor oil, even if you don't have anything to do with cars. You've seen fresh motor oil. It's relatively clear. It flows really smoothly. And then when you see old motor oil that's coming out of the car, then it's all sludgy and thick and not moving very well. So imagine if you don't change the oil in your car over time, it destroys your car. This is also an analogy to what's going on with your blood sugar. If you have way extra blood sugar in your bloodstream, then that means that all that sugar is in there doing damage, just like with your car. Your car doesn't want that sludgy stuff, and your blood vessels don't. So in the human body, a blood vessel, the largest one is about the size of your thumb. So see that. And then the smallest one is a third the size of a hair. Can you even see this hair in my hand? So 1/3 the size to this size. If you have a body, blood vessels that are loaded up with sugar going through this big vessel, it might damage that vessel, but it's going to take a while. But if it goes into the really small vessels, which are your eyes, fingertips, your toes, then you may end up with some really bad outcomes like heart disease, All that is tearing up the inside of your blood vessels, and it's going to create a situation where it's scarred. Your eyes have very, very, very small blood vessels. And sometimes when people have diabetes, the first thing that they know is that they can't see. Can you imagine what it would be like to wake up to find out I can't see? And many people will say, you know, my vision was getting a little blurry, but I'm older, so I thought that it's just old age. Don't ever diagnose yourself. Kidney disease, a great number of people with diabetes have to go on dialysis because their kidneys fail. And then, of course, to have a heart attack. It's terrible if you find out that the reason you have a heart attack is because your blood sugar has been out of control for so long, and it's something that could have been fixed. Now, many of you know about the finger stick. You've been at a mall or somewhere and you've had your finger stuck, or at the doctor's office, and the blood sugar results that you would want to get from that would be between 60 and 99. If you come back and they tell you your blood sugar is a little high, and you say, what is my number? I want all healthcare providers, if there are any on this call, to stop telling people that your number was a little high or was a little low. Give them the numbers, because it's normal for them, and they need to know what's normal and abnormal for them. Now, if it's over 100, if it's 100 or over, it means that your body is starting to not be able to handle the sugars as well, but it also is dependent on what you ate just before you had your finger stick, and is also dependent on whether or not you tell a lot of lies to yourself and your doctor. And so you know you're going to get your finger stuck, and so you eat right for 2 or 3 days beforehand. You don't do any drinking, you don't do any smoke, you don't do anything that aggravates your body or changes your blood sugar. And then you go and you get that 99, and you're like, see, I'm doing better. And you know you're lying to yourself, and what good is it to lie to the doctor? But if you get a hemoglobin A1C, which is a much more specific test because it's an indication of what has been going on average for 3 months in your body, and you can't lie out of an A1C test, then you need to know these numbers. If someone says your A1C was low, you say, what was it? If they say it was a little high, you ask the numbers. Always ask the numbers. So let me give you a way to remember what you should know. Pre-diabetes is between 5'7" and 6'4". To be normal, to have normal blood sugar, is to be below 5'7". So let's just say Valda, that is me, is a good person. You've already figured that out. I'm amazing. I'm wonderful. So 5'7", 5 feet 7 inches tall, or 5 feet 6, we'll go with. 5 feet 6 inches tall is a good number. That's going to be my height for today. Valda was in love with a guy who was 6'5". He was fine, 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 but he wasn't worth a cuss. So you know that if your blood sugar is higher than Valda is tall, so if it's 5'7", that's the beginning of pre-diabetes. And if it's 6'5", that means you have diabetes. So Valda's a good person at 5'6", and we'll say Tom was 6'5", beautiful, but not worth a cuss. You don't want any of that. So keep your blood sugar, A1C, at below 5'7". And some of you are being treated, maybe the first time you went in, your A1C was something really bad, like a 10 or a 12, and you've been trying to get to 7 as a better number, which is a better number, but your goal needs to be to try to get to normal if you can. And other things that in your environment, stress, the psychology of stress is so poorly understood. Very few people understand how much damage stress can do to the body. And very few people would ever have thought they would experience as much stress as we have since March of this year. In January, we were just cycling along thinking that, oh, there's some kind of disease, but it's not here. By February, oh, it's only in Washington State, nothing to worry about. And by March, it was like, oh my, it's everywhere. And I hope that you have been paying attention to the numbers, and you will know that we are at an all-time record-breaking, horrifying number of new cases, new deaths, and about to overwhelm the healthcare system. And I know that in the part of the country where you are, the healthcare system is not one that is well equipped for you to get to it. Sometimes just physical distance. So you may be very stressed. You may be doing things like working from home and zooming in nonstop while you are also trying to have the right device for your child or your spouse or someone else in your family to be able to do their homework or work. Most people are not a 5-device family, but there's been a struggle. So there are many kids who don't have what they need, and their parents are trying to juggle how to do their work, also how to be a teacher. I don't know about you, but I think I'm pretty smart, but the stuff that I see on little kids' homework assignments just makes me get really stressed. And then the kids are feeling the sadness from not being with their friends. And many adults are not recognizing how much stress they have because they're in this confined environment. Trust me when I say that the majority of people I have surveyed say that even if their job was stressful, they appreciated the amount of time it took them to go back and forth to work. They used that commute as a means of leaving everything at home and not yet being involved with everything at work. So if you are only commuting from your bedroom to the kitchen, it can be problematic. We'll talk about ways that you can do something better with that. Fear. I know that I severely limit my activities. I do go out and about, but I pay attention to what time of day I go out. I never go into a place to shop when it's peak time. I will go at 6 in the morning or at 1 in the afternoon if I'm going to go shopping. I just know that the more I am exposed to the virus, the more likely I will have it as a problem. And we just talked about the fact that diabetes and COVID-19 don't go along. I worry about people that I love who don't have a choice. Those people who are essential workers and have to be right out there every day, who know that they have diabetes, but they cannot afford to take off work. I pray for them and I work with them to try to make sure that they are doing the best that they can and having the most safe environment possible. We're all pretty sad. I know that Thanksgiving is coming up and I love Thanksgiving. My family environment over Thanksgiving is just wonderful. We might have 40 people together. I cook for 2 days. Everyone brings their very best food to the table. And yeah, we don't want anybody trying any new dishes on Thanksgiving. Okay, so remember that. And we have a great time. But this year, we're not doing it. We are not going to take the chance of being together. So that increases our sadness and sometimes makes us pretty angry. Definitely is pretty frustrating because not all of this had to happen, but it's here. And then do we feel guilty? If we're the people who are doing okay in the midst of this, do we feel guilty? Or let's just look at this from the lens of having diabetes. I know people who have been really, really worried about having the loss of vision or losing a limb because their parents or their aunties or grandparents had diabetes. And sometimes they feel a little guilty because they feel 100% healthy. It's kind of like survivor's guilt. Don't let that be a part of who you are. How can you do something about it? If you can't get outside, you can do things inside. Exercise is one of the best ways for making sure that you change your internal environment. It helps you so much biologically and psychologically just to get out and move around, even if getting out means going in the basement or in the other room or locking the bathroom door and saying, I have my 5 minutes. Plenty of studies show that if you will just take 5 minutes to yourself, just slow down. I want you to do this with me. Take your hand and rest it on your belly. For those of you who don't have much of one, rest it on your 6-pack. For those of you who have a lot, rest it on your Buddha, whatever the case is. Put your hand there and now take a deep breath as I count to 5. 1, 2, 3, 4, 5. Now let it go out slowly. 1, 2, 3, 4, 5. If you do that for 5 minutes a day, the American Heart Association says that that will help lower your blood pressure by as many as 6 points. And blood pressure, blood sugar, and cholesterol are an unholy trinity. When they're out of whack, it makes each system worse. So take the time, even if you're at work, just take slow, deep breaths for 5 minutes. There are apps out there like the Calm app and others that will help you have time for yourself. I'll give you my case study. At some point, I went to the doctor. I wasn't feeling well. I was tired. I was sluggish. They checked me out. My blood sugar, 6.1. Remember, 6.1 is not where we want to be. We want to be under 5.7. But what I had been doing was walking in my house, taking off my shoes, putting on some pajamas, drinking a big drink of Coca-Cola, Mountain Dew, probably accompanying that with a big bucket of chicken. That's all I was doing. Everything was negative. But once I was told that my blood sugar, my A1C was 6.1, they said, well, we want to put you on metformin. And I thought, well, I don't want to be on any more medications. I had managed to get myself off of that 12 from the other thing that was going on. And here I had the 6.1. So I said, instead of going on medication right away, how about if I just try to go to the ground? This is my way of fixing things when they're out of whack, because I have been doing what most Americans do and not paying attention to what I put in my mouth, using energy dense food, meaning loaded with sugar and fat and all those things, and not getting any activity. So I put down the sodas. I made sure that when I walked in the house, I put on my exercise gear, or better yet, I carried my exercise gear with me all the time, so that if I had a chance, I could get off my pumps, my high heels, my stilettos, and get out and walk around for a while. And I started to incorporate that into my day. Additionally, I determined that sleep was something I had been sacrificing for a really long time. And sleep is one of those things that is restorative. There are many studies that will show the effect of a lack of sleep, a lack of exercise, and poor diet as being critically bad to your health, especially diabetes. Now, as I worked it out and worked it out and worked it out, and since 2016, when my hemoglobin A1C was 6.1, it is now 5.4. Yay. And this shows you, this is my very own health information, that on April 25th of 2016, 6.1. In 2019, 5.6. And now, just last week, 5.4. That's because even though I don't do everything well, I try to make the best possible choices every day. I try to keep my internal environment. I try to keep my mind such that I know I have to do better because I want to live better. Another thing that keeps us from moving around as much and that can affect our blood sugar is our arthritis. And unfortunately, with age, and anyone who's been an athlete is very likely to have problems where your body decides to fix your cartilage loss, and your cartilage is that cushion between your joints. Somehow it decides that the fix is a bone spur. And so now you have bone on bone going. You have it from the top and the bottom, just like in a cave, stalactites and stalagmites, and it doesn't feel good. And so that limits how much you do, and inactivity is such a killer. But even more importantly, as we become less and less active, we usually get bigger and bigger and bigger. And so the interesting thing to know is that extra weight equals extra pressure on your knees. If you are 10 pounds overweight, it's the equivalent of walking around with 40 pounds on your knees. So if you had a little toddler that you were dragging around on, let's say like a 4-year-old or a 5-year-old dragging around on your knees, you know, that's fun for a few minutes, but imagine if that's happening all day long, but that's what your body feels. And so then if you've gained 100 pounds, your body feels like you're walking around with 400 pounds. And unless you got 2 kind of fine football players that you're carrying around with you, I don't think that's good. And anyway, they should be carrying you around, not the other way around. But even if you have extra weight on, you can start doing things to help your knees feel better. Instead of doing this treat pose, which is a standard yoga pose and a simple one, I had to start off with the bush pose. All I could do was get my foot up to my ankle, but I did it. And that over time increased the space between my joints so that I didn't have so much bone on bone. It was like it created a scaffolding that kept me from hurting. Why was that important? Because then I could get out into my external environment and do things. I joined classes. I went to the Y and I joined a class with seniors because I thought, well, they'll be easy to keep up with, but these were smart seniors who had, for most of their lives, been incorporating exercise. And anytime I go into Asia, like in China, you'll see people outside doing Tai Chi. And this is something that has become a part of the environment for the community. It makes it not only simple to do, but it's an expectation that you will do the best that you can. Yesterday, I saw the beginning of the Masters golf tournament. And Gary Player, who is 85 years old, walked out to hit the first shot off the tee. 85 years old. He walked out there with all the swagger you would want. He popped that thing off and he looked great. That is my goal, that I do the things that I need to do now so that in my senior years, I am really healthy and able to have good quality of life. And then I was told that because my knees were so bad that I was going to have knee replacement surgery, but I did these things. I lost weight, I exercised, and now no surgery. No one has talked to me about surgery for about 3 years now. And I can get up and down from chairs, not screaming and crying, because I worked out with my blood sugar. I didn't let that stop me. I didn't let my arthritis stop me. I played basketball, jumped hurdles, ran track, played racquetball, all the things that damage, and we won't talk about wearing stilettos all the time, but I don't need surgery anymore because I took my life back. Now, here is the environment that's mainly killing us: lies, mistakes, and misinformation. We tell ourselves that because we have been told that I can't, or we say to ourselves, I can't get out and exercise. I can't do this. My neighborhood is unsafe, so I can't go walking. If you change that to I won't, see how ridiculous it sounds. I won't do the things that I need to do to take care of myself. I won't eat right. I won't get out and exercise. And if you can't physically get out, you can do everything you need to do in your house if you have to. Or if you have been told that your grandfather died of diabetes, or your mother lost her legs to diabetes, your sister is blind because of diabetes, that you will be too. Your internal, your psychological environment needs to be changed because you don't have to have the same outcome. Some of what goes on with us is genetic, but some of it is familial, which means that our families did it, so we did it, and we end up with the same thing. And then there's misinformation. I don't eat much and I exercise so I can eat whatever I want, or just leave off the sugar. But no, it's more than that. Make sure that you're talking to people like Rhonda or certified diabetes educators who can help you understand what to do. And then here's like the biggest lie ever, our portion sizes. If you ever get a chance to travel outside of the USA, especially if you go to Europe, you in Asia, you will find that nobody has portion sizes the way we do. Nobody. But we have been taught and believe that we have to have supersize. And if we get a plate that isn't just like, ugh, about to break our hands, we think we haven't been given enough food. But what you can do to help yourself, even if you go out and you get lunch and you go where they do throwed rolls, I've been there, where they give you so much food that you just toddle out as you go. It is so good though. Even if you do that, take a plate home. Take your lunch home, split it into 2 portions. Most of the time, anything we get out in a restaurant in the USA these days is enough for 2 portions. At least make it 1.5. Make it your goal that when you get up from the table, you are satisfied but not stuffed. And then measure your food at home. If you have been using olive oil or other things to try not to have so much fat or to try to get more into vegetable-based oils, if you're using 2 or 3 tablespoons of olive oil, you put 400 calories into your food by using that much olive oil. Pay attention, measure things out. We do a whole bunch of screening these days, and there's evidence from the American Diabetes Association that sitting in front of a screen actually is very stressful, and it can actually wreak havoc with your blood sugar in a number of ways, including if we don't de-stress enough before we go to bed. Like, we need to do some sleep hygiene by shutting off all your devices, getting away from blue light. Then you're not going to sleep as well. And again, sleep is restorative. You need that. So if you're watching TV, looking at your phone, try to make sure that the last 2 hours of the night, you don't do any of that. And then there's actual exercise. If you do have to be sitting at where you are right now, right at your table, at your desk, looking at your phone all day long, then do what has been called a commercial diet, where at certain times, certain breaks, you just do things. You lift weights while you're sitting there. If you're looking at television, 22 minutes out of every 30-minute segment is content and 8 minutes is a commercial. If you just exercise those 8 minutes every half hour, that's 16 minutes an hour. So in 2 hours of watching TV following this schedule, then you will have 30 minutes of activity. And just get up in between and do some running in place or lift some weights or use the stretchy bands, but keep up with it and you will see your body changing because you're helping your internal environment. Don't be afraid of the scale. I know I was forever. Stop being afraid of the scale. The scale is okay. Find out where you are and it will help you see where you're going instead of thinking, oh, I'm fine. And now as we're pulling out our winter clothes and finding that, oh boy, none of them fit. Had we been looking at the scale, we could have made changes, because anytime you have weight gain, you increase your BMI, you increase the likelihood that your blood sugar is going up and everything is going bad inside. Your physical environment, if you have the opportunity to go out and fish, I know they have the fishing clinic there with MBRC, or just go on some trails, or just get out and about and see beautiful, clear skies. It's great for you. And this helps your body by moving and by getting to a place where there's less probable stress. If you are unfortunate enough to live in the Western United States where there have been fire after fire after fire, or if you live in a highly industrialized area of the country, then try to make sure that you're not exposed to this type of problem. This also creates irritants. Irritations can make many of your systems work harder or not work as well. Think about your physical environment and what you can do from the community standpoint. If you are seeing that there's more and more trash and more litter, and unfortunately a consequence of COVID-19 with people wearing masks and gloves, somehow they decide that those masks belong on the ground instead of in the garbage can. If you are thinking that your personal community is less and less savory, then perhaps you can organize a community event where you're getting people out, cooperating with each other, staying socially distanced, but cleaning up the environment. It's bad for us personally. It's bad for animals. They're finding so many fish now that have plastic particles in them because so many gloves and other pieces of plastic have been tossed into systems that end up in the waterways. Because think about it, if you're having to just go pick up food all the time now, they're using disposable containers. Those containers end up in the trash. Maybe they end up in the landfill, or maybe they end up in the waterways. There are many things that we can do to make this better. Another thing that you can do to help your environment is to eat locally. Whenever possible, use a farmer's market or a local market where you know where the food has come from and that it hasn't required a whole lot of gas, oil, diesel, time, money to be trucked from one place to the other or flown in from another place. And besides, that way you are supporting the people locally, which will make that economic environment better. Many people now have decided that they will have their own garden, whether they have a little herb garden on the back porch, if they're doing aquaponics, just doing inside with water and air, or if you have a farm or a plot of land where you are growing things, it's good for you. It's good for you physically. It helps you move. There's nothing more satisfying than to see your first fruit or vegetable erupt, and nothing tastes better than something you grew yourself. This was me 3 or 4 years ago when my blood sugar was out of place, when my arthritis was cranking up where I couldn't get up and down. Anytime I'd sit down, I go, oh. Anytime I get up, I go, oh. And walking up and down steps was pure torture. Somehow, even with all the knowledge that I had, I'd allowed myself to gain that much weight and not do the things that I needed to do. But at some point, I caught myself and I did better. And that is what Rhonda does for you. She helps with that. So to end up your environment, physical and psychological, call to check on people or just reconnect with friends. It helps you here. Keep a gratitude journal because we have a whole bunch of bad stuff going on. But if you write down 3 things that are better every day, it will help you. Smile, 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 smile. First thing and last thing, your body feels it. Move, move more, move often, eat better, and get enough sleep. Here's my prescription for better health. This will be available to you later, so make sure that you're doing these things and saying what you will do to improve your health, because it is cheaper to promote health than to maintain people in illness. I'm Valda Ford. It's always a pleasure to be here with you. And if you have any questions, I'm happy to answer them.
Okay. Thank you so much, Ms. Valda. That was amazing, as usual. We always enjoyed listening to you as well. It's always so much good information.
Thank you.
I haven't seen any questions, just lots of super nice compliments. So everybody loved your presentation and you did a great job and we appreciate it. We are going to, if nobody has any questions, we're going to go ahead and move along. And if you think of a question later, you just type it up and we'll make sure that Ms. Valda gets it, okay? Okay. Thank you so much. Okay, so next is going to be Alan Beck. And so Dr. Beck, if you want to get your screen ready to share, and then, okay. And I'm going to ask you to unmute yourself. See if we can get you unmuted. Oh.
Can you hear me now?
Yep, we pushed it at the same time.
Okay, sorry about that.
Okay, no, it's okay. So you're good. So you can start your screen share and then we'll be ready to move right along.
Okay.
Thank you for joining us today.
Of course. Can you all see my screen?
Yes,
Okay.
I can see your screen and I can hear you good.
Okay, good. I will go ahead and get started then. So first of all, thank you all for having me. I don't know why I have to follow Miss Valda. That seems kind of unfair. Her presentation was amazing. I think you should do everything she said, basically. So I'll go into this too. I do apologize ahead of time for my slides can be kind of wordy. I tend to stay away from that, but I want to make sure that after this session, you all can have my slides and you can have all the information too. So a brief overview of what I'm going to talk about is I'll tell you a little bit about myself so you know who the heck I am. I'll talk a little bit more about diabetes prevalence. I'll kind of glaze over what is diabetes because she did a great job going through that. Some of the costs, then speak specifically to nutrition for diabetes and exercise for diabetes, and then any questions you may have. So you may ask, who is this guy? This is where I began my fitness career. This is a photo from the USA Today in June of 2006. This is in the Balad, Iraq intensive care unit. So I was hurt whenever I was over there playing around in the sands of Iraq. I came back through the various hospital systems, Walter Reed in Germany and elsewhere, back to what I called Fort Living Room, Steelville, Illinois. So I'm from a relatively small town. It's across the river from Perryville, if you don't know where Steelville is at. But I'm a rural guy myself. So when I started my bachelor's degree, I began with criminal justice. But however, I found it really interesting how my body was adapting to the various trauma that I was going through at that time and switched to exercise science. So towards the end of my bachelor's degree, I began to apply for jobs in the fitness industry. However, everybody wanted a bachelor's degree and 2 years of experience, which how do you do that while you're getting a degree? Our rec center director came to me and said, hey, we want to pay for you to be our personal training and fitness assessments graduate assistant. They basically said they're going to pay me to get my master's degree. So I took them up on that offer and then went and pursued my master's degree in exercise physiology specifically. Towards the end of my master's degree, I landed a job working as a clinical exercise physiologist and cardiopulmonary rehabilitation at Southern Illinois Healthcare in Carbondale, Illinois. As I was working that job, I became really interested in clinical populations, specifically our rural heart failure folks. You know, Medicare and Medicaid just approved cardiac rehab for these people. What we found is that nobody was attending. We really couldn't figure out why. So I went back and got my PhD in health education to better understand the behavioral component of exercise. I have some certifications. I've been a personal trainer for quite some time now. Certified inclusive fitness trainer, that's a certification specific to people with various disability states. Went on and got my exercise physiologist, which is specific to like the management or running of an exercise facility. Even though I don't actually do that, I still have I'm certified to do so. And then lastly, I'm a certified clinical exercise physiologist. So that's specific to people with known disease, diabetes, heart disease, pulmonary disease, those kinds of things. As I was finishing up my research study for my PhD, what was stark to me was that I had about 65 people in my study that I was doing surveys with. And as I was doing my study, about 5 or 6 of them had passed away. And then since my study in 2017, about 12 more have passed away. That got me more interested in preventing disease, not just trying to treat the disease, because as was the previous presenter said, it's easier to prevent than it is to treat for sure. So I work now at Washington University in St. Louis, and I'm a part of a project actually local to Southeast Missouri trying to increase physical activity in folks down there. It's called Heartland Move. So if you see that, that's what that is from. We're trying to get people to go out and use, if you have walking trails, walking paths, go out and use them because you have them there. So the diabetes prevalence, I'm going to show you what we in public health call heat maps of the US to demonstrate how diabetes has spread over time. I'll note whenever there are like specific indicators that change. This is the US in 1994. I was in 4th grade. So as you can see, there are people at various states, but in general, diabetes wasn't too bad. South Carolina, I think, is where it was the worst at this time. And I'll go through these kind of slowly, but just see how things change. So in 95, what we're seeing is that over time, these colors are going to get much more dark, and dark means bad, basically. So in 1998, we had to add a category of 7.5% to 8.9% of folks having diabetes because it was beginning to increase more. In 2001, we had to add another category of greater than 9%. In 2002, we had to actually drop a category because the less than 4.5% prevalence doesn't exist anymore. It came back in 2004, but mostly because the data from Alaska was a little bit, a scientific term for this is wonky. It didn't come back very well. As you can see, in 2009, Alaska's data came back so wonky, they dropped it off the map. In 2010, we had to remove the category of 4.5 to 5.9% because we were already over that now. What we tend to see, so 2014 is the last map that I have, we tend to see over time is that diabetes prevalence tends to begin in the lower Mississippi River Valley and up into the Appalachians as well. So the latest data I could find is from 2018. So Colorado is our best state right now with 7% of people having diabetes. And our worst state is West Virginia at 15.7% of folks having diabetes. As was previously mentioned, most cases of diabetes are type 2 in nature. I spoke a while back to some folks about pregnancy and exercise. And it turns out if you develop gestational diabetes, it will likely go away after you have the baby, but there's about a 50-50 chance it'll come back within 5 to 10 years. This is also covered too, but to diagnose this, it's either a fasting glucose, oral glucose tolerance test, which if anybody's ever had that, you take this, you drink this very disgusting, typically orange flavored drink that is gross. To test your blood sugar 2 hours later. But really the hemoglobin A1C is what was spoken about previously. That's really the test that you can't lie. You can't change that test because it gives us a view over the past 3 months or so. I often had patients in the hospital that would say, oh, I've been keeping my blood sugar under control, and their hemoglobin A1C was like 14, which means their average blood sugar was over 400, which is really, really bad. So you can't lie your way out of that one. If we look at Missouri overall, the overall prevalence of diabetes in Missouri is about 14.7%. Unfortunately, as you all probably know, counties with the highest prevalence of diabetes are generally in Southeast Missouri. It's within this ring here. The highest, the top 4 I could find on here were Iron County at 21.1%, Ripley County at 20.7%, Mississippi County at 20.2%, and then New Madrid County at 18.4%. So in general, Southeast Missouri is where diabetes is really hard on folks. So what is diabetes? Again, Ms. Valda did a fantastic job going over these, so I'll be brief here. Essentially, your blood glucose, your blood sugar is too high, and over time that leads to insulin resistance, which just means that it's not going to uptake glucose as well as it used to. That can lead to pre-diabetes, which then can lead to full-blown diabetes. She also spoke a lot of like secondary conditions, so cardiovascular disease. I mean, most people that I talked to that had open heart surgery, stents put in, heart failure, almost all of them had diabetes too. In general, diabetes tends to not be by itself. Cardiovascular disease, which is about 32% of type 2 diabetics also get cardiovascular disease, but that number is a little bit skewed because it also includes young people. It includes people from very young ages all the way up to 100 years of age. So as we age, the risk for cardiovascular disease tends to go up. So at least 68% of people over 65 with diabetes will die actually from some sort of heart disease. So it leads to these other things. A lot of this from the damage to the vasculature. And she did a good job pointing out, it's essentially, if you cut your arm, what happens is it scars over and scabs over, and then you heal. The same things happen inside of your body. So whenever you have that very thick blood, the viscous blood in there going through your arteries, that damages the lining of your arteries. And what happens is your body heals. It will help, it creates kind of like a scar tissue on the inside. And over time, that scar tissue narrows and narrows and narrows until it gets blocked off. So that's how these all lead, how diabetes leads to these various secondary conditions. A little difference here between type 1 and type 2. The main things is that type 2 tends to happen in older folks, although that's not always the case anymore. Type 2 diabetes tends to progress slowly to where type 1 tends to be a rapid onset. Environmental factors, when you look at these with type 2 diabetes, obesity, poor nutrition, physical inactivity, the good thing here is that we have control over these things. Your behavior can impact these things. Nutrition status tends to be obese or overweight. Symptoms tend to be similar or may even have none. Oftentimes they come on so slowly that you can't even tell you have a problem until it gets to be really severe. There's some stat out there that about 1 in 4 people find out they have diabetes because they have a severe issue with their diabetes and they get hospitalized for it. The control, you have control over this. It is variable because not everybody does the right things, unfortunately, but it has helped quite a bit with diet, exercise, and weight loss. You don't have to have insulin if you're a type 2 diabetic, but it's required for about 40% of folks. And then some oral medications tend to be relatively effective for type 2 diabetes. So as I said, these environmental factors and nutrition factors, you actually have control over those. You get out what you put into those. And the same with the control. So again, diet, exercise, weight loss will go a long way for individuals. So some risk factors for diabetes. Age, typically over 40, but it is becoming more common in younger folks. I've read quite extensively about the Bogalusa heart study has shown us that kids are developing diabetes at very, very young ages, like even preteen ages. So that's pretty scary that that's happening in young folks. Obesity, so what happens is with obesity, you have these hormones, these inflammation markers that are all very high, leading to the insulin resistance. Folks tend to think that excess body fat is just sort of sitting there. It doesn't do anything. However, body fat actually is active. It sends signals to the body to create various hormones. Physical inactivity. So jobs are becoming more and more sedentary. The irony of this as an exercise physiologist, talking to you as I sit in my office chair is I get the irony there, but it's often thought that folks in rural areas are all farmers, when in actuality, very few people actually farm in rural areas, actually are farmers. The next one is family history. The joke I always told, in the hospital was, if you wanted to be healthy, you should have chosen better parents. Obviously, you can't choose your parents, but what we found is that with genetics, type 1 diabetes tends to have a larger impact than type 2. But your genetics are not the end all be all. So you can have really poor genetics, but still have a relatively healthy life. This comes from a lot of twin studies. So if twins are at a very young age are split up and one twin goes to live with a healthy family and one twin lives with an unhealthy family, after 20, 30, 40 years, we look at these folks, the people that were in the healthy family tend to be healthy. They tend to not have high blood pressure, heart disease, diabetes, where conversely, their twin, again, they have the exact same genetic makeup. Their twin has every risk factor, if not having these diseases already. We talked about a history of gestational diabetes, so just diabetes whenever you're pregnant. Race or ethnicity, so minorities tend to have higher levels of diabetes. However, it's not all necessarily due to ancestral heritage. So it doesn't mean, it's not because you're parents, it's because we think of other things like health disparities. So these things that come into play are like lack of access to healthcare, not going to see doctors because you have some sort of mistrust, because historically minorities have been treated really poorly in some research studies. And, we hope we can overcome that over time. Next is the cost of diabetes. So this is my favorite slide because I just like to see numbers to understand really how the burden on society as a whole and on the individual plays in here. So direct costs of diabetes, $327 billion per year in the US is spent directly on diabetes care. That's an astronomical amount of money. $1 in $7 of healthcare money is spent on diabetes. Folks that have diabetes have 2.3 times greater healthcare costs. That costs you like almost 3 times as much for your healthcare as it does for somebody without diabetes. We also see this when it comes to healthcare premiums. So if you have known diabetes, heart, whatever it is, their insurance companies, we're trying to protect conditions you already have. However, that isn't always the case because health insurance companies know that if somebody has diabetes, they want to charge them more because they're going to pay more for their healthcare in the long run. And on this, people with diabetes spend about $17,000 a year on healthcare, and of that, about half, a little over half, is spent directly to diabetes. Diabetes, if any of you have it out there, it's not a very cheap condition. When you have to buy the monitors and the test strips, the medications, the hundreds of dollars per month in co-pays that I heard, that's a real thing, and that has an impact on people. Some indirect costs. So people that have diabetes tend to not go to work because of their diabetes, so about $3 billion a year. If you don't go to work, you can't be productive, obviously. So that's $26.9 billion per year. Some folks just can't work anymore because of their disability, because of their diabetes, about $37 billion per year. And loss of productivity due to early mortality is about $20 billion per year. Essentially, you can't be productive if you have died. That's the take-home message there. So now into more of the fun stuff that I like. So nutrition for diabetes, which you already gave some really good sound advice for this, and I appreciate that. Limit foods that are high in sugar. That probably seems kind of like a no kidding, like duh, of course, but it has to be stated. I have to make sure and put that out there. Foods typically fall into one of two categories. So high glycemic index foods or low glycemic index foods. Examples of high glycemic index foods would be something like candy, processed bread, sugar sweetened beverages, those kinds of things. These cause a very quick rise and a very high spike in blood sugar and then a quick drop off thereafter. Examples of low glycemic index foods would be things with whole grains, vegetables, those kinds of things. So they have a slower rise in your blood sugar. It doesn't spike it as high and it maintains blood sugar over time. Eat smaller portions throughout the day. Smaller portions, there's some evidence this is also good for generally everyday healthy people. However, it's much more important for diabetics to be able to maintain a stable blood sugar throughout the day instead of these large peaks and valleys. So over time, if you eat smaller portions of good foods, your blood sugar maintains a steady level instead of having to go up and down, which is really bad for the body. Eat a variety of whole grains, fruits, vegetables every day. Obviously, we all know whole grains, fruits, and vegetables are good for us, but these are probably more important for diabetics to maintain a steady blood sugar. And you may ask yourself, but Alan, aren't fruits high in fructose, which is a simple sugar? That is a great question. Yes, they are actually. But if you have a choice between a Milky Way bar and an apple, I would recommend you choose the apple because while it still has simple sugar in it, you're also going to get many more vitamins, minerals, fiber. You're going to get water from that because there's also water content there. So obviously an apple is a better choice than a candy bar. Hopefully that's not new information to anybody, but if it is, make sure you keep that in the back of your mind. Eat less fat, really important in trying to reduce body weight overall. she had mentioned previously, if you just use a few tablespoons of, even though it's good fat, it's still fat. So fat per gram has 9 calories, to where things like protein or carbohydrates have 4 calories per gram. So there's more fat there. So even if you eat good fats, which I recommend you do have good fats, you can typically tell good fats if they are liquid at room temperature. If they're solid, like something like a steak at room temperature, that's not good fat for you. But again, if you're going to have good fats, still have them in moderation. Limit your alcohol intake. For one, they're hidden calories. There are 7 calories per gram of alcohol, so they're actually higher than carbohydrates and protein. Tends to cause accelerated damage to your liver and blood vessels. And then lastly, which people don't think about this, is folks tend to not have great decision making when it comes to food whenever you've had alcohol. We tend to eat more and not make good, healthy decisions. So just keep that in the back of your mind too, especially as the holidays come upon us. Use less salt. Diabetics typically also have high blood pressure or hypertension, so reducing the salt will help to reduce the blood pressure as well. A couple of practical considerations for nutrition. If it tastes good, spit it out. I don't see a problem with eating cardboard and mustard. Now, these first two, obviously, these are jokes. Hopefully you all laughed out there in Zoom world. But these are things that we talked about a lot with our cardiologists when I worked clinically. In general, I mean, they're kind of good rules of thumb, but you don't have to have, disgusting cardboard tasting food to live a happy lifestyle. You can have good foods that still taste good, that are good for you. So one tip that we often give folks is to eat before you go grocery shopping. So if you're hungry, it's a bad idea to go grocery shopping, because you're likely to pick out things that, especially if your blood sugar is kind of low, you're more likely to pick out really sugary items and things that are just not good for you at all. When I say shop around the store, that means shop around the perimeter of the store and try your best to stay out of the aisles. Food stores are smart. They will say, well, we keep things like the staples, things like bread, milk, eggs, in the back of the store because they require refrigeration, which they do. Obviously, you want to have your milk be refrigerated, but they also put those back there because the staples that you go in the store for, they force you to walk through the entire store to get to them. So you're more likely to pick up other items when you're on your way there. But if you shop around the store, you tend to have fruits, vegetables, meats, dairy, going to like the lower calorie stuff and trying to stay out of aisles. Look for whole grain and high fiber foods. They typically tell you if they have whole grain or high fiber in them. Again, they try to trick you, and stores are very smart. If you look at where cereals like Fiber One are at, they tend to be kind of higher up on the shelves. And cereals like Fruit Loops and Cocoa Puffs tend to be lower down because that's where kids' heights are at. But even those sugary cereals are now putting on there the little G or whatever for General Mills saying that, oh, that now has whole grains. Just because Fruit Loops has whole grains in it does not mean Fruit Loops is good for you. So still look at the label and understand the nutritional content overall. Do not drink your calories. Number one, whenever you drink like a sugar sweetened beverage, all that sugar, you don't really, it tastes good and you love it, but you don't notice it. And your body will also digest that very quickly. And you get essentially no nutritional value for that. So whenever you drink calories, your body stores it very efficiently because it's already basically broken down for you. So be cautious about drinking your calories, especially if it has a lot of high sugar in them. When dining out, send half your entree back to be boxed. So a lot of my patients that had diabetes, that was one thing we recommended in our diabetes classes that we taught. They would have them, so before they'd even bring their food out in some cases, if they dined out, they would have them cut everything in half and put it in a to-go box. So again, having those calories over the day is better than having a lot at once, because oftentimes, like Valda said, Now you should leave the table being satisfied, but not like stuffed. Not every day shouldn't be like Thanksgiving. You should feel, okay, I've eaten my food and I'm good, and then move on, as opposed to just stuffing yourself gluttony style. With that same thing in mind, understand the serving sizes. Serving sizes are always a lot smaller than you think. For example, one of my favorite foods, and my wife can attest to this because she buys peanut butter for us, is peanut butter. I love peanut butter, and I can speak to understand serving sizes. And every time I look at the serving size of peanut butter, I'm just like disheartened, because 2 tablespoons is not that much in my world, as much as I love peanut butter. So understanding that, that's when you need to cut yourself off. Other things when it comes to serving sizes is never eat something directly out of the container. So for my peanut butter, I take 1 scoop and I eat it, and I take a second scoop and then I close the container and put it away. Things like people tend to eat ice cream out of if it's a small container, especially right out of the container. You should scoop that out separately in the right serving sizes and put it away, because you're more likely to overeat whenever you have that humongous serving right in front of you. And we're all guilty of it. It's not, I'm looking at you all, myself included. These are things that I do for myself too. Exercise for diabetes, and even prevent diabetes. But if you have diabetes, always, always, always check with your doctor to make sure exercise is safe for you prior to beginning an exercise program. I will say, however, generally speaking, you might be hard pressed to find a healthcare provider to tell you maybe you shouldn't go on a walk. Like you're going to be hard pressed to find those folks. Typically, they're going to say no if you have diabetes and you haven't ever exercised, you haven't exercised for a very long time, and you want to take on something that's like very, very high intensity or vigorous intensity exercise. They may caution against that, just because you want to make sure you don't overburden your cardiovascular system and hurt yourself in the long run. But in general, most physicians are going to say, yeah, go for a walk. That's a good thing. So this table I'm going to show you depicts exercise and physical activity's impacts on various parameters in diabetes specifically, and I'll go through each one individually. Aerobic capacity or fitness level, you could increase your fitness level. People think, well, I'm too old to see any improvement. You will see improvement. It will happen eventually. Your resting pulse goes down. So what happens is, just like any other healthy individual, if you have diabetes, as you begin to do your cardiovascular exercise training, your left ventricle of your heart will get larger in a good way, and that allows you to pump more blood with each beat. Therefore, your pulse at rest will go down. Your blood pressure, so Valda talked about the various, looking at the cross section of your arteries. What happens are 2 different things as we age. You get arteriosclerosis, which is the buildup of plaque inside your arteries. And then you get arteriosclerosis, which that's what you may hear, hardening of your arteries. That's what that is. So what happens is, as we begin to exercise, the muscles that surround your arteries contract and relax. And if you haven't done that for a long time, they may be kind of hard, but over time, they will begin to adjust and adapt to that. So over time, your blood pressure actually goes down, because your body is better able to relax the blood vessels. They aren't as narrow as they used to be. So whenever you put the same amount of fluid, blood, for example, through a larger tube, the pressure is lower, obviously. It's like kinking a garden hose, unkinking a garden hose. Your HDL, which is the good cholesterol, that goes up. That's a good thing. You want to have high good cholesterol. Your bad cholesterol, the low density lipoprotein cholesterol, will go down. And then when you look at the risk ratio, what we do is take your total cholesterol number, divided it by your good cholesterol. Well, total cholesterol divided by good cholesterol, that gives us a ratio of something to something. That tends to go down too, which is a good thing. Your body mass index, so you can lose weight, and then as that goes down, your body mass index goes down. So too does your body fat percentage. You're more likely to lose more body fat in this way whenever you exercise with diabetes. Your insulin sensitivity actually goes up, and fat metabolism goes up too. So insulin sensitivity, exercise has an insulin-like effect on your body. So whenever you begin to exercise, what happens is the blood sugar, the glucose inside your arteries and within your body is used up because you have to use that for exercise for the muscles to contract. It's a fancy thing called glycolysis. So as it breaks that down, your muscles are using the blood sugar. Therefore, insulin sensitivity goes up because there's less blood sugar inundating the insulin in itself. It's a good thing. Your hemoglobin A1C goes down. I think the previous presenter was showing her numbers, how they went down with her behavior change. This slide is great, but that slide's way better because it shows that it can be done. So you can decrease your hemoglobin A1C. Your self-esteem goes up. You tend to feel better about yourself whenever you're active. Your depression and anxiety goes down. So that's a good thing, especially right now in the times of COVID, whenever we're all depressed, anxious, tired, we're kind of over this, but I recommend you stay the course and keep doing things right to keep yourself protected. And the same thing with stress. Stress goes down too. So you can use activity to help impact how you feel too. So it's not just about the numbers, the body fat percentage, the A1C, the fitness level, the pulse, the blood pressure. It's about how you feel too. They tend to make you feel better. So this is going to be kind of a confusing chart, but I'll go through this individually to help you. So on the left-hand side, whenever we prescribe exercise, we use the FIT method, the frequency, intensity, time, type. There are other acronyms, but I won't go into those today. Those are way more confusing. And then across the top, you see cardiovascular exercise, strength training, and flexibility to have a good holistic view. So what I'll say with frequency first is start out slow. If you have not been active in the past or recently, start out slow. Don't try to just hit the ground running because you might end up hurting yourself or being very sore thereafter. So with cardiovascular exercise, we're looking at most days per week is the preference here. Try to not have more than 2 days consecutively without having some type of activity. Strength training, it's fewer, 2 or 3 days per week. Flexibility is the same way. Now, whenever I put 64 to 85% of your heart rate max for cardiovascular exercise, because nobody knows what the heck that means, I have a way easier test for you to see where you're standing when it comes to the intensity of your exercise. Now, when I used to work at the rec center, I would always go in and see people, walking on a treadmill, watching TV or playing a game on their phone. If you don't get to a certain level, that's not necessarily going to improve your fitness level and help with all of those benefits that we just saw before this. However, if you're gonna, read a book or watch a TV show or something, even if you walk at a slow pace, I recommend that's a good thing. But with intensity of cardiovascular exercise, we're looking for moderate to vigorous exercise or physical activity. And the test for that, for moderate intensity, if you can talk in a complete sentence, but you cannot sing during the activity without having to catch your breath, you're probably at a moderate intensity level. With vigorous intensity, you should not be able to say more than a couple words without having to pause for a breath. So if you're going for a walk with a friend and you're talking to them, you can talk back and forth. That's a good thing. But if you were in your head or have a song on your phone, if you can't sing it, that's a good thing. If you can sing it out loud, you want to increase the intensity a little bit more. So whether it's speed up some or try to go up some hills, something like that to increase the intensity. And then running with vigorous intensity, you shouldn't be able to say more than a couple of words without having to pause for a breath. Strength training, how I look at this is if you can do a push-up, if you can do 15 to 20 push-ups in a row, you probably need to add some sort of resistance to that because it's too easy for you at that point. And flexibility, the intensity is mild discomfort, so you shouldn't be bouncing trying to hurt yourself. But if you stretch and hold and you feel like a slight discomfort, that's a good thing for sure, not pain. I would say if I were in person with this, I would show you some exercises, but we're all via Zoom, so you get this really boring table that I have made. The time for cardiovascular exercise, they recommend 30 to 60 minutes per session, which would equate to 150 minutes of moderate activity per week or 75 minutes of vigorous. However, there is a cumulative effect here. If you can't walk for more than 10 minutes at a time, that's fine. You can go for a walk 10 minutes in the morning. You go back out 10 minutes at lunch and then 10 minutes in the evening. That adding that up counts as 30 minutes. That counts towards these guidelines. We used to always say that in physical activity as a whole, that it didn't count unless it was for 10 minutes in a row. But then we would tell people, well, you should take the stairs, or you should park further away when going to the store. That message doesn't make sense, because if you park further away or take some stairs, it doesn't take 10 minutes. However, we have more evidence now that says that even those little changes have huge impacts over time. If you are sitting at your desk or your table or whatever, getting up and moving around, walking in place, all those things that Valda had said as recommendations, I 100% agree with those. Those are Allen approved. I will say one caveat that I thought in the back of my mind is, I've had many clients in the past where they would watch television, they would get up at commercials and just kind of walk in place or walk around and get some movement. However, if you're watching something like Netflix, where it just goes from show to show to show and doesn't give you that time, I recommend that time in between, you just pause it and then go do your activity and come back. Don't just get on a Netflix binger and watch TV for, it's amazing how fast time goes by when you're watching television. With the strength training time, in general, 1 to 3 sets. So do 1 set of push-ups, that should be good. 8 to 12 repetitions. If you can do many more than that, you need to add some sort of resistance to that in some way. And flexibility tends to be a 2 to 4 sets, so a couple of each exercise. So you stretch, if you're going to bend down and try to touch your toes, hold it for about 10 to 30 seconds and then move on to the next one. And then type of exercise. I have examples here: go for a walk, jog, swim, bike, whatever that is. In general, it's whatever you enjoy. If you enjoy, playing basketball or playing flag football, or whatever it is you enjoy, do that. Because if you try to make yourself become a runner, I can say 100%, I hate running. I do it. I know it's good for me, but I hate it. My wife, however, loves to go for a run. It helps her distress and get through her day. The point here is, if you don't enjoy whatever activity you're making yourself do, you're not going to do it for the long term. You're going to quit very quickly. So just be aware of that. Strength training, all major muscle groups. So your chest, your back, your shoulders, your legs, do all together. Flexibility is you stretch and hold. That's kind of the type you should do. In general, the biggest bang for your buck when it comes to these categories of cardiovascular exercise, strength training, and flexibility, cardiovascular is the biggest bang for your buck. That's going to have a really big impact, more so maybe than the other ones. But what you learn is over time, you need those other things too. As we get older, you want to have flexibility. I've had a couple of clients that one of their goals was to put their pants on by themselves, which as a younger person doesn't make sense. But as we get older, those things become more tedious and more challenging than you might think. So some recommendations for whenever you begin an exercise program, if you have diabetes, check your blood sugar. Make sure you know what you're at. In general, if your blood sugar is high, you should either exercise with caution or not take part in it. If your blood sugar is low, you can have a snack with some carbohydrates in it to help get yourself back up to where you need to be. And between 100 and 250, you can go ahead and exercise. Keep a daily log. Especially be aware of, this doesn't just mean a daily log of your exercises, but also your blood sugar. So knowing where your natural highs and lows are during the day will help you understand when it's best to exercise or when not to exercise. But whenever you add exercise, it's going to have an impact on your blood sugar. As I said, it uses glucose. Plan for exercise. If you need to, carry some carbohydrates with you in case you have a low dip in your blood sugar. Just be aware that might actually happen. People tend to get really sweaty and they pant and kind of turn whitish color. You can tell when somebody has low blood sugar. Adjust your insulin accordingly. Again, exercise has an insulin-like effect on the body, so you don't want to have, they recommend, the American College of Sports Medicine recommends you limit your insulin, your fast-acting stuff before you exercise to about half of what you would normally use if you use insulin, because if you give yourself 100% and then go be active, your blood sugar is going to drop even further. So just being aware that that might happen and might not feel very good. It's always recommended to exercise with a partner. for a couple of reasons. Number one, you don't know what's going to happen with your blood sugar, so it's good to have somebody with you that can help you if you need it. But number two, they also keep you accountable. This is good advice for anybody, whether you have diabetes or not. To have somebody that's going to help keep you accountable is going to be good for you in the long run. Wear an ID tag. Whenever I was a kid, my grandfather was type 1 diabetic. He had one on his watch. These can be much prettier now than they used to be. They used to be very like boring looking things, but whether it's a bracelet, a necklace, or something on your watch, just something so that if something does happen, first responders have an idea of what's going on with you. And then modify your calories you're going to intake. Just be aware that you can change those as you exercise too. Just a few practical considerations here. We've always heard this, aim for 10,000 steps per day. That's not always the case. I guess I could give you bonus points if anybody knows where that comes from, but 10,000 steps per day comes from a Japanese pedometer, the thing you wear on your hip to count steps. They had to come up with a number, and they said, 10,000 sounds good. In actuality, if you get 7, 6, 7, 8,000 steps, that's pretty good. The key here is try to increase your steps per day. Try to be more active than where you're at right now. For example, walking about 1,800 steps if you are a man and 2,500 steps for a woman is about the distance of 1 mile. If you're running, the numbers come down because you take longer strides because running has a flight phase to it. About 950 steps whenever you're running for men and about 1,900 for women. Again, this is if you're running. A rule of thumb overall, this varies among people obviously, but if you cover the distance of 1 mile, whether you're walking or running, you burn about 100 calories. As you increase your miles, those numbers become more and more off, but in general, 100 calories for 1 mile to give you an idea of how many calories you're burning. Especially among diabetics, wear very comfortable shoes to ensure a good blood flow, especially if you're having neuropathy issues. And as I said previously, do something you enjoy. Again, if you're going to go for a run and you hate running, you're just not going to stick with it for the long run. Life is a marathon, it's not a sprint. We want to get to the end over time. So this little boring model that I have up here is called the socio-ecological model. So when we look at this, it started in the 70s and 80s by a guy named Yuri Brofenbrenner, who actually brought this up as it relates to child development, but we in public health kind of stole it and made it our own now. The basics of it is that not everything happens at one individual level. So what often happens with folks that have prediabetes, diabetes, we blame the person. Well, you got diabetes, it's your fault. You do have control over it. That is 100% accurate. As our previous presenter showed, she took control of it and knocked it out of the park like a rock star, which is awesome. But just realize that there are other pressures around you when it comes that impact you directly. So if we use exercise or physical activity as an example, so intrapersonal is kind of within the individual. If you're not motivated to be active, you're probably not going to be active. I use this same model when I talk to my patients in cardiac rehab that are smokers. If you don't want to quit smoking, I can tell you all the information in the world about how it's bad for you. It won't matter because you don't want to listen to it. So let's say, okay, you are motivated to be more active. If you don't have the interpersonal, the next ring, if you don't have somebody to help you, to help have a family support person, your community is not very supportive of people being active, that could be detrimental, obviously. You go to the next level where the community overall, so the community, if you don't have a place to go and be safe, where it's like a walking trail, where it's off the beaten path, if your sidewalks are all in disrepair, you want to go for a walk, but you're going to trip and fall and smash your face in, you probably won't go. If the community is not allowing you to be healthy, be active, you probably won't be active. On the policy or the physical environment, those kinds of levels, it's going to start getting cold soon. It's kind of cold today, but it's going to get cold, rainy, snowy, just terrible outside. If your community, some communities have what we call like a shared use agreement, where you can use like a local middle school or a high school as a community member and come in and walk around the gymnasium. But if your community doesn't have something like that, you're more likely to not be active. I want to make sure people understand that we can't just blame the individual, even if the individual is very motivated to be active or take better control of their diabetes. I will say a hard-headed individual is the way to go because they see these barriers and just knock them down. But we can't always blame the individual because sometimes the setting puts you in that the context has more than I would say than what the actual impact of the individual has too. So thank you all for your time and attention. I appreciate the ability to come and chat with you all today. I know my talk was kind of boring, but hopefully that makes you be active. The key to this is sit less and move more, whatever that may be in your world. So go with God, and thank you again.
Okay, thank you so much. Definitely not boring. Super, super good information. We have received some positive feedback, and then we also have a couple questions. I think I've seen 2 of them. Let me pull that back up.
Sure.
Okay, here we go. Okay, the first one, so we had somebody ask about when you were starting the walking group. Oh gosh, I'm going to say the name wrong. The Walk Fit group.
Mm-hmm. So when are we starting walking groups? When are you going? Okay, yeah. So yeah, with our walking group, so as a part of this Heartland Moves program that we're running from WashU with folks down there, the pandemic has hit us hard too. So a lot of what we plan to do is, have walking groups, have folks from different homes come together and be members of a walking group. Well, with COVID, you can't really do that, even though it's a pretty low risk of exposure to COVID whenever you're outdoors. But so right now, our main focus is we're going to try to look at trying to get folks to be active within whatever unit they're in. So for example, if you have coworkers, Rhonda, if you have coworkers around you, you're exposed to every day, it's probably pretty safe for you all to go for a walk. We have gotten some feedback from folks that have run various programs down in the region that since the pandemic began, walking on their trails has increased, especially among families. You see a lot more mom, dad, kids out on and using the trail. So trying to encourage folks to walk in that way too. Here's hoping that the words of all these vaccines coming out continue to be positive and we can get those, and then we can go back to more of our original plan. But our plan moving forward now is to focus more on the pre-made groups, whatever that may be, whether it's work or family or what have you.
I think that's great. I know we have a couple of coworkers that actually do get out and walk. So I do think that is very awesome. And it's good for everything, we can spend more time together and exercise. Okay. So the other question, if you're currently eating fruits rarely to not at all, is it a good idea to get your servings of fruit from juices such as Naked or Boathouse?
So what I would recommend, that's a great question, by the way. Make sure you take that, whatever product you're considering ingesting, and you turn it around. You look on the backside because that's what matters the most. You can actually look at some fruit juices that don't have any fruit in them at all. So I would say if you're going to get the servings that you need, that's probably okay, but be aware of the line where it says added sugar. If there's a lot of added sugar to that, you probably want to stay away from that.
Absolutely.
I see another question too from Miss Valda. I appreciate that.
You already read it. If you read it, you just go. Well, I'm going to read it in case you haven't.
Okay, yep, go ahead.
Okay,
go ahead.
So our next question is, if your arteries have started hardening, can you reverse it by being more fit?
Easy question. Yes, you can. The elasticity of your arteries it's not set for forever. You can actually, exercise will have that impact. That's how it's one of the mechanisms by which you reduce your blood pressure, by having your arteries be able to expand and contract more.
Awesome. Okay, and we have another question that came in also. If you eat the same amount of calories that you burn, does this keep you out of the danger zone of diabetes?
Generally, I would say yes. So if you're eating what you burn, there's no net gain or net loss. So you should maintain your weight. However, not all calories are created equal. If you're getting most of these through drinking things, that has a bigger impact on the hormones too. So in general, I would say you're good, you're set. But if you're trying to lose weight, you want to burn more calories than you eat, obviously.
Okay.
There are all kinds of really boring, nerdy calculations I could do, but I promise you I won't bore you with that stuff. But yes, if you're eating what you burn, you're good.
Okay, thank you so much. For people with a lot of excess weight, recommendations for movement. So, and I see morbid, so I'm thinking like morbid obesity.
Morbid obesity is always a difficult thing. So those things I mentioned earlier about exercise and activity has a cumulative effect. Even if I've had many patients in the past that they couldn't walk even for 10 minutes. They had to walk. They started by walking 2 or 3 minutes here or there. If somebody is bedbound, it's nearly impossible to get activity. But there are some ways of doing it where you're just even moving your arms, trying to move whatever you can. But people that fall into the extremely morbid obesity categories, it's much harder to be active because the adipose tissue, the fat, oftentimes you can't bend your knees very well. You can't get up very well. That weight on your knees, as Valda pointed out, that weight on your joints is horrible. So taking your time and getting your movement going back up, if possible, try to start out if you have access, but access to a pool is nearly impossible. I don't have a pool. I want one, but I don't have one. That can help relieve some of the weight on you as well.
Thank you so much.
Yeah, thank you.
Okay, that was some wonderful information. We really appreciate you joining us. Just an announcement real quick. So we are, due to technical difficulties earlier, we didn't get into Rico's presentation also with the childhood wellness program. So we are going to move that towards the end after Mark because it will flow nicely with what he is talking about. So we are going to move our schedule ahead and go ahead and move on to break. So instead of it being 11:05 to 11, let me pull up my time right here, guys, make sure I don't lie to you. Okay. So instead of it being 11:05 to 11:20, we're going to do 11 to 11:15. And I really hope everybody joins us after break. I think we've learned some very valuable information so far. And then during the break, I will have my computer on. There won't be any sound, but I'm just going to play a slideshow for anybody that wants to look through it of some of our graduates and different events and things that we have done with the Boo Hill Health Alliance. So we will see you guys back at 11:15. Thank you. Okay. I want to welcome everybody back, and I want to apologize about the slideshow. It would not let me play it. It kept kicking me out every time I tried to share it on the slideshow screen. You test that stuff out and try to do it beforehand, but for some reason you get everybody on here and it just doesn't like to cooperate. So I can send that again with the PowerPoints, and I apologize. I see that Letitia, you've got yourself unmuted. So if you want to go ahead and try to get your screen shared. Yay. Okay. So our next speaker is Letitia. We are very excited to have her here with us today so that she can share this information. And I hope you guys enjoy our presentation. And again, if you guys have questions, just type them in the chat box and I will facilitate them at the end. So Letitia, whenever you're ready.
Well, good morning. I was going to say afternoon. We're getting close though. Good morning, everybody. My name is Letitia Glassby Harris. I go by Tisha the Therapist because that's the name of my practice, and it's easy to remember because my name is very long. I'll tell you a little bit about myself. I am a licensed professional counselor, mental health service provider, and a national certified counselor. I attended Freed Harmon University in Henderson, Tennessee in 2016, graduated with a Master's of Science in Clinical Mental Health Counseling. I have a bachelor's degree from Union University in Germantown, Tennessee. I graduated with my Bachelor's of Science in Health Management and Organizational Leadership in 2013. I also have 25 years of healthcare experience. I always tell people that my plans were to be a nurse practitioner, but God plans was for me to be a mental health practitioner. So I always say that I am integrating mental health and wellness for purpose. And that's how I got the lead of being a mental health provider that specialized in diabetes education. Also, I have a certification in medical assistant, certified nursing assistant, and I also run a private practice and a mental health counselor for Christian Brother University here in Memphis, and also do independent contract work for another agency called Forward Counseling, where I mentor and do life coaching for youth girls and women health issues. And I address the needs of people with diabetes, specifically women. So to just share that a lot about me. I have a broad background in mental health and also healthcare, but diabetes is near and dear to my heart. Moving along here. So when we're doing mental health and wellness, what comes to mind for me is most people don't know what mental health is. And when we think about mental health, I'm guessing it's from experience or from life experience, from family or being in the social realms of things. People always look at mental health as being bad, which is not. It has a lot of stigma surrounding it. I think the stigma is caused by personal and social family experiences, and it also stems from not having an understanding of what mental health is or the information about it. So just to let y'all know what mental health is mental health includes our emotional, psychological, and social well-being. It affects how we think and feel and act. It also helps determine how we handle stress. relate to others, and make choices. Mental health is important at every stage of life, from childhood all the way up to adolescence until we become adults. It's a part of us. I always tell people that mental health is treating the whole person. Not only are we looking at your brain activity and the way you think and feel and your emotions and thoughts, we're also looking at your physical being, your physical activity, your physical understanding of things. And so moving along to that, we're going into what wellness means. So mental health and wellness, how do you combine those two and why are they so important together? As I spoke before, mental health and wellness to me is integrating both the physical and the mental. So wellness is not the mere absence of a disease. It is a proactive, preventative approach designed to achieve ultimate levels of functioning. Growing up, I would attend doctor appointments with my mom, who is Native American Indian, and my father, who is African American. My father is deceased. However, my mom is still living and still resides on an Indian reservation in Oklahoma. However, our prevalence for diabetes was high on both ends of our culture and our race. Very high because of the way that we eat, the way that we live, the different traditions of food that we practice that are part of our culture are very high in carbohydrates, and we pretty much fry everything. Let me put it that way. So with that being said, wellness does not only come from what we eat, but it also comes from what we think and what we feel and how we behave and what our body or lifestyle is, the things that we do to it or for it. It also comes from the spiritual realms, our belief in the things that we're practicing or that we're eating or sharing with each other when it comes to wellness. Wellness comes to mind when you're thinking about being sick and then you're going through a recovery period and then you're being well. But it not only means that for the body, but like I said, again, it always go back to the mind, where people always seem to put a stigma on the mental part of it. So as I said before, the stigma comes from a lack of understanding, a lack of information in the different cultures, communities in our society today. So we are moving along to that so I can get to why I decided to integrate mental health and wellness for purpose with mental health and diabetes. It goes back to me. I have a personal story, so I'm kind of changing the game a little bit for you all for this workshop, because it will kind of let you lead how a mental health practitioner got into wanting to specialize in diabetes and the complexities of the disease itself. June the 29th of 2015, I lost my husband to diabetes, undiagnosed diabetes. I found him unresponsive in our home after returning from the University of Arkansas in Pine Bluff. I had taken our daughter to college orientation up there. Didn't know what he had passed away from that day. Had no idea. All I know is before that time happened is that he was ill that Father's Day of 2015, which was June the 21st. I just thought of maybe he ate something wrong because we went out to eat that day at IHOP, and we ate like steak and eggs for breakfast. And anybody ever been to IHOP, you know it's not the cleanest place there is, but it's a place that we all go to have fellowship and communion with our families, especially in the Black communities. And the food, it's affordable. However, he was sick prior to me finding him that day. And after all the things and chaos had left us, and I got the autopsy and it told me he had a hypoglycemia crisis. I had no idea what that was. I instead of me going into a chaotic state where I were grieving and being upset about the loss of my husband, I was more upset because I didn't know why he died. or what this thing was, this hypoglycemic crisis. So what I did was I had this urgency. Now I know it was God, but I had this urgency to find out what diabetes was and how do you get a hypoglycemic crisis? How did that come about? And so I set out on a mission. Others now call it my pain to purpose, but I set out on a mission to find out all about diabetes. And on that mission, I was welcomed by many people in the healthcare community, many people that were nurses, doctors, and mental health professionals, helping me find my answer. So on that path, I became an advocate for diabetes, not knowing much about it, but learning everything I could and grasping on to everything that any information they could give me they could share with me. And so grasped onto this one lady while I was working at the military Navy base as a mental health professional. And she directed me to Methodist Le Hospital, Germantown, where they had a diabetes outpatient program. And in that program, they wanted diabetes educators. Well, I'm a mental health provider. They don't have mental health providers as diabetes educators. They only have nurses. They have psychologists. They have doctors. My specialty or profession was not on there. However, what I found was that God opened doors that are not always visible to you. A door was open for me. I was the first and the only African-American female that was able to go through that program in less than 2 years and become a diabetes educator as a mental health provider. I learned about the specialization in diabetes, the complexities, how to treat it, how to educate. Also got, through that program, got offered a stipend from the Call of Congress in 2019. I got to travel with my young son, who's now 10, and he's also a diabetes educator, to Washington, D.C., Capitol Hill, where I got to meet and speak with congressional leaders, Steve Cohen, Mark Green, Marsha Blackburn. I got to meet all of those people. I got to sit in and vote on a bill in the House of Representatives for diabetes, for the funding and affordability for insulin. All these things brought me closer to who I am and where I'm supposed to be in life in regarding to integrating mental health and wellness and the needs for people with diabetes. Later on that year, God was not done with me yet. I traveled a little bit more. I still worked as a mental health provider for different agencies, and got a call from my mentor, my diabetes educator mentor, who said, "Hey, what are you doing?" And I'm working, of course. And she was like, "Oh, I got something for you," not knowing if it, if that's a fit for you or not, but I know how your passion is about diabetes and all you wanted to do and what you wanted your practice to look like. And I have another stipend for you. I have a stipend for you to be a certified lifestyle coach for the National Diabetes Prevention Program. And in this program, you will learn how to teach and educate people with diabetes about physical activity and also eating healthy in this 6-month to 12-month program. It is recognized for CDC. Are you interested? Of course, I said yes. And I was out traveling again with my sidekick, my young son, who is also named after my belated husband, Garen. And so we go, and we both are certified lifestyle coaches for the National Diabetes Prevention Program, which I also offer that program into my business, Tisha the Therapist. So that is a little about me and why I am integrating mental health and wellness for purpose for mental health and diabetes. So getting into my educational part of it for today for mental health, wellness, and diabetes integration. Again, mental health for me is now being more recognized more as a critical component of any diabetes care plan because its issues go unrecognized and untreated. Care can become undetermined and diabetes management impeded. Diabetes care and education specialists have a critical role to play in helping people with diabetes get the help they need because they're a perfected position to notice when an individual is experiencing distress and can serve as that conductor to mental health professionals. These statements to me are very true because they describe who I am and how I came to love and continue to learn about treating people with diabetes and wanting to help them get to the next level and letting them know that their care is just as important as any other mental health issue that could be addressed, and that mental health issues do not defer them from getting the quality of care that they need. And that there's people out there such as myself out there willing to help them understand and get the information they need in order to be able to manage and get educated and prevent diabetes. Diabetes, of course, it impacts us so many ways in our mental and our wellness and in our health and our physical bodies. It impacts our relationships. It impacts how we think about things. I mean, when we go to the doctor, first thing I noticed after my husband passed away was there was no real screening for diabetes. I mean, there's a screening for cancer. There's a screening for HIV and AIDS. They have a screening, a mammogram, of course, screening for breast cancer. But there's no screening other than the blood glucose test that they prick your finger with. If you're coming for your annual physical, that's when they check it. You can't walk into a doctor's office or a facility and say, hey, I want my blood sugar checked because I think I got diabetes. Because most people don't have the knowledge or the understanding to ask for that or know the signs and symptoms of diabetes to even know that they have it, because they mirror so many other things that we are going through or may experience in life when it comes to our health. So what is diabetes? Ms. Ford really went into that with that, and I was just so happy with that. You just don't know, Ms. Ford, how enlightening it was to listen to your humor and also for you to educate about diabetes again, because I was like thinking when I was doing my slides, I was like, hey, I don't want to, they know what diabetes is. I don't want to go too deep in depth with it. So that really helped me in my, tied into my own presentation today. So briefly, what diabetes is for me on my end as a mental health provider, and how I explain to my clients or patients is it's a disorder of the metabolism where the pancreas produces little or no insulin, or the cells that do not respond to the insulin produced. Glucose or sugar builds up in blood, overflows, and is lost into urine. Meanwhile, the cells are denied their source of energy. And so I always let them know that energy is our fuel. It's the thing that makes us run. And if we can't get that, we have to have another source in order to provide that energy for us so we can live. And having diabetes does not make us less than a person. It does not make us poorer than anyone else. And our quality of care should not be halted because we have diabetes or our pancreas is not working properly or not working at all. Again, there's people in the mental health field, such as myself, that's there to address those needs and to help you understand, what diabetes is for you, what it looks like for you, and what it can be for you. So just to go by the numbers of diabetes, and I thought this was very, very interesting because this was one of the first things that I did run upon after my husband passed away was this slide here from Health Central. And the first one that hit me was 7 million, the number of people with undiagnosed diabetes. And so going back to the originality of my husband passing away, I knew nothing of diabetes. I had no information about it. I only heard what the stigmas and the myths of it was, because I heard I had an uncle that passed away of diabetes. I had an uncle that went blind from diabetes. I had a cousin that leg got amputated because of diabetes. And I always thought diabetes, my older generation would always say sugar, diabetes, sugar, or my sugar was acting up. Those were the things that I heard. So I'm, of course, being young, I'm thinking sugar is candy, chocolate, sodas, things of that nature. So I never thought the way that you accumulate diabetes could be inherited, or it could be the way that we're eating, or the way that we're caring for ourselves. So my husband fell in the range of the 7 million of people, number of people that was diagnosed for diabetes. Even though we went to the doctor every year together annually, only thing that was ever done for us was the blood sugar that was in our CBC, which is the complete blood count. And if that came back normal, there was no probable cause to do another test to check to see if you have any kind of diabetes problem. You didn't go to a primary care physician and tell them about your foot is hurting. You went to a podiatrist for that. You didn't go when you're having vision problems and say, hey, I can't see, to my primary care physician. You went to the eye doctor for that. And so what I found was there was a need for other providers, other professionals, mental health and healthcare, to collaborate, to come together to provide optimal care for people with chronic illnesses such as diabetes. Them working together can pinpoint or address those needs and properly refer them out to the individuals that they're needing to do the whole mental health and wellness of that person, and to help them treat and prevent the diabetes that they have, and to also refer them to the resources, because many of the people that have diabetes, especially in my African American community and my Native American community, we don't have the resources. I mean, there's transportation issues. We can't get to our doctor appointments. There's food insufficiencies, where we can't eat the type of foods that we're told by our primary care physicians that we're needing in order to sustain or reduce the weight of our obesity or our health issues. I don't know why it is, but it's cheaper to get a McDonald's cheeseburger than it is to go buy vegetables and fruits. So of course, then there's that choice. And then having a lack of resources when it comes to financial stability. Most of the people that have diabetes and families of children that have diabetes, they're on a fixed income. So they can't afford to go out and buy this expensive food in order to eat healthy sometimes, or they don't live in an area where they can grow a garden and grow and have their own food and prepare their own food in that manner. And some don't even have the knowledge. So as me, as my family laugh at me, I can't cook, so I order everything pretty much, which is very sad, I know. However, the thing is that I don't have the knowledge to know how to prepare the meals that I need. So there needs to be someone in place in order to be able to teach us and show us how to prepare our meals. And then I know there's my mom that I often fuss at, and she's 5'1", and I call her a little lady, and she's a little Native American Indian, and she's very, very, very outspoken. And when she gets upset, I always tell her to pipe down, little lady, and pat her on her head, and she always laugh. And so I was 5'3" one time in my life, but I was like, okay. However, I know her situation is with her diabetes is that she's prepared her food for so long, a certain way for so many years, that it's hard for her to come to terms with, instead of doing those turnip greens with that salt meat in it and that fat back in there, how about exchanging it for turkey? How about, cooking it in chicken broth instead? It just takes a lot for her to, want to change those things. But changing and getting new habits and preparing our meals and foods and things for our day comes with practice. That's going to happen overnight. I know people are set in their ways, and diabetes has got more prevalent in our society and in more in our communities these days, that everybody we're turning around, like type 1 diabetes is the most common chronic disease in children now, which used to be juvenile. So now is juvenile, the age of the range of juvenile has increased. It's not they're born with it, or now they're 10, 13 going to find out they have diabetes. And then there's like 30 million number of Americans now living today with diabetes. And going back to the 80 million number of adults who have pre-diabetes, they could go either way, based on their physical activity and based on how they're eating. And what I always tell other people when they come in to me for mental health issues, and they also have diabetes, which is one of the things I ask when I am scheduling a client, especially a new client, when they come in. My first thing is, have you been tested for depression, depression? And the second thing, do you have a health-related illness, such as diabetes? Because I specialize in diabetes. And the majority of my clients all have diabetes, and also are coming either for a mental health illness as well, preferably and sadly, depression and anxiety, because diabetes has brought so many distressors into their lives that they're ashamed. They are unknowledgeable of what they need to do. They don't have the money to treat their diabetes or buy their insulin or get their medicine. They're having to choose between paying their utility bill and buying their medication, or not having enough money to buy their medication, or not having enough food in order to eat properly, to make sure their diabetes is under control. And so also people look at mental health as being a barrier for getting treatment for the diabetes. It can be, however, that goes back to the stigmas of the activity that people with diabetes have a structured lifestyle, and that the stigma is an experience that we didn't learn from our families. We didn't learn from friends, from our personal experiences, from hearing about other people's experiences with diabetes. And then knowing that they have a mental health issues, or they're feeling some kind of way, upset because they've been diagnosed with diabetes. Shame because they don't have the money to go and buy the supplies for the glucometer machine, or to get by the medicine. And so it brings us to psychosocial stressors and diabetes. Psychosocial stressors and diabetes is depression, is anxiety, and is diabetes distress. And knowing the signs can help us so much, and be just a lifesaver for us all that know people with diabetes, that take care of people with diabetes, or ourselves that have diabetes. Knowing how you feel and not being ashamed to share how you are feeling when it comes to your health and in your mental well-being. So diabetes and depression. Diabetes and depression rates are significantly elevated. That means they're higher among people with mental health illnesses, because that happens because you have diabetes, you either have depression. And if you have depression, you either have diabetes. So it's like double trouble all the way. They seem to hang out with each other far too often. And sometimes diabetes seems to lead the way, and sometimes depression leads the way. One makes the other worse, and vice versa. When these two are together, it's difficult to find the energy to do anything. The more manageable for your diabetes, the less likely you are to take steps to change your mood. If your diabetes are not manageable, you might not do the things you would normally do to stay healthy, like exercise, healthy eating, seeing your friends, and generally just being active all together. You may be more likely to watch TV or eat sweets while you're sitting there, or you may be sleeping too much or not enough, and distancing yourself from others. The cycle is very painful, and it requires strength and persistence to find your own way out of depression. But depression and schizophrenia are risk factors for the development of type 2 diabetes due to their impact on the body's resistance to insulin. People with mental illnesses also experience many of the other risk factors for diabetes, such as obesity and high cholesterol levels. The biological impact of high blood sugar levels is also associated with the development of depression in people with diabetes. So when we're going into doctor's office, I know they're doing it more now because of COVID, but what I have my clients to do when they come in to see me, or my practice is basically virtual, if I have to go out and do a workshop somewhere, I have them, and I would like for you all to do it with me today, is just take the time, and you can use the chat if you want, and I just want you to screen yourself for depression today. Most people don't know what depression is. Most people don't know the signs and symptoms of depression, but knowing those things can ultimately save you and allow you to be more attentive to your diabetes needs and the concerns in order to make sure that you stay in compliance and in management of it. So the symptoms of depression is what we need to know about depression is sadness, anxiety, guilt, anger, mood swings, feelings of helplessness or hopelessness, irritability, crying, withdrawal from others, neglecting your responsibilities, change in personal appearance, moving more slowly, being agitated all the time. Everybody just making you mad for nothing. You don't know what you're mad for, or unable to settle. And in your thoughts, depression also frequently self-criticizing. You're putting yourself down. You feel bad about yourself. You're to a point where you feel like you should be further in life than you are now, but you've accomplished so much, but you don't see that. Or impaired memory and concentration. You can't focus like you used to. You're not attentive to things like you used to. You're starting to forget more. Confusion. Most people don't realize they're confused, but other people see that before they do. Thoughts of death and suicide. You're thinking about people that have passed along before you. You're thinking about all the people you done lost in your life. You're just sitting there contemplating about what your life would be if you wasn't here. Physical depression is chronic fatigue. You're just tired for no reason. You get up tired. You don't even know what you're tired for. A lack of energy. You hear yourself, as my mom says, she's Native American, but I always tell her she's a little black lady. I say she's an Indian in a little black lady's body. She calls the word energy gumption. And she's like, I don't got no gumption about myself. Then she's saying that she don't have any energy. Sleeping too much or too little. Weight gain or loss. And you can see yourself, and most people don't know they do that with their physical activity with diabetes and depression. And what they do is that they will, my mom, I have to go back to her all the time because she has diabetes, and I realized what she was doing and why she wasn't losing the weight that she was losing. She's doing something what we call as intermittent dieting, but she didn't know that was called that, of course. She would get up early in the morning, she would drink her cup of coffee. But she wouldn't eat for the rest of the day until it was dinner time, and it's time to go to bed now. And so now when she eats, she's eating a lot and she's getting ready to go lay down. You haven't ate all day. So your body don't know when you're going to feed it again. So your body is storing up the fat that it already have because it's going to go into starvation mode because it don't know when you're going to feed it again. And so you're not losing weight. You're not losing it. And she will always say, she was like, Tisha, I don't know why I'm not losing weight. I don't eat that much. Yeah, but your body don't know it either. Your body don't know when you're going to eat again. So it's saving up what you already ate. So also with physical depression, there is a loss of motivation. Not having the willpower to want to do anything or to go anywhere or to talk to people. And it goes back to irritability. Everybody's just getting on your nerves. Everybody, just something is wrong with everybody for you. And also substance abuse also plays an issue in it. As I tell people all the time, and I'm an untraditional therapist because I talk the way that my community talks. And that's why I do have a high rate in African-American people, Native American people, and Hispanics coming to me because I don't sugarcoat anything. I speak to them as they speak to me on their level, and don't act like I'm above them or below them. I'm right where you are. I meet you where you are. I'm from where you are. I am you. I'm just a different version of you, maybe a little younger or maybe a little older. However, when I tell them, I was like, I have many that come in that have drug problems, which is also a mental illness as well, or disorder. And I told them, I was like, yeah, when you get through smoking, that problem's still going to be there. When that high wears off, it's still going to be there. So what are you going to do today to change that problem? How are we going to improve this? So substance abuse is also part of depression, and it makes it worse as well. Unexplained aches and pains. Some people come in, it's like, I'm just hurting. I don't know what I'm hurting from. It's not the type of pain that's in your body. It's the pain, it's a mental anguish pain. It's a pain where you don't know where to go, like you're stuck in a rut, as I would say. You don't know if you're coming or going. That's your alert that something is not right. Something needs help. You need to talk to someone. So here is the symptoms of depression that you're now doing in your local doctor's offices, in your health community centers, when you go in. And just I want you all to take the time to do this with me and check your depression level. And so you must have 5 or more of these most of the time over at least the last 2 weeks to diagnose yourself with depression. And if you do, check yourself off or for 5 or at least 5 of these things, I urge you to go and speak with a mental health professional today. Even if it's less than 5, you should still speak with someone or even your healthcare provider if you have diabetes in regards to how you're feeling. The first one be fatigue. In the last 2 weeks, have you felt fatigue, which is tiredness? In the last 2 weeks, feelings of worthlessness, guilt, excessive sadness for no reason at all, or you don't know where it's coming from. Over the last 2 weeks, have you experienced problems getting to sleep or sleeping too much? Over the last 2 weeks, have you lost weight or gained weight? Over the last 2 weeks, have you had difficulty concentrating or making decisions? Over the last 2 weeks, a loss of interest in usual activities. And what I mean by that, you might be in a person that the casino is big in Arkansas, so, and I think Missouri too. So maybe you was a person that liked to go to the casino every Saturday and wanted to go and get those crab legs on Saturdays. And now all of a sudden Saturday come and you don't have, as my mama said, no gumption to go. And so you're changing your activities, you're changing the things you do. You rather stay in the house, you rather be alone with yourself, and you're having difficult thoughts about guilt and feeling overwhelmed about stuff, or worry about things that you know you can't control. The next thing was, over the last 2 weeks, thoughts of suicide. And when people say suicide, I didn't realize how many people did not realize what suicide was. And suicide is the act of thinking about harming yourself or killing yourself. And it's something that should not be taken lightly. It should not be something that should be played about. And it should be something that is addressed if you see a family member or friend going through that, especially with diabetes. Diabetes brings so many feelings of, oh my God, inadequacy. What did I do wrong? What did I eat wrong? Did my family do that? And so is it inherited? Even though our prevalence in the African American community and the Native American community and Hispanic community is very high for diabetes, that doesn't mean that we have to continue going that route. There's so much out there now, so much information. And I always go back to myself because I'm trying to advocate and promote other people to come on as mental health professionals, to come on and take the lead with me and treat people with diabetes, because it brings on so much when it comes to the way that we feel, think, and act, and the things that we do in our lives. And so the last one is, in the last 2 weeks, are you feeling restless or slowed down? So again, I go back to the originality of these questions. If you have experienced 5 or more of these things in the last 2 weeks, I urge you to go and speak with someone, whether it be your professional, your primary care physician or mental health provider. It could be a therapist, counselor, psychiatrist, anybody. Just let them know how you're feeling, because depression is real, and it can take a toll on you, and it can ultimately be the thing that can help you manage your diabetes better if it's under control. And you may ask, what can I do if I do have these symptoms? What do I need to do? Where do I go? First of all, of course, like I said, speak to your primary care physician, or speak to someone in your family if you got a support person, or go to your doctor. What can you do? There's no sure way to prevent depression. Everybody experiences it, but there's a certain level of depression that each and every one should experience. And some of it sometimes it's too high for us. So find ways to handle the stress that you're having and improve your self-esteem, what you think about yourself, what you think about others. Take good care of yourself. Get enough sleep. If you're not sleeping well, please talk to your doctor. I found out recently that I have sleep apnea and didn't know it was hereditary. And so I'll be putting on a CPAP machine to go to sleep at night. Eat well and exercise regularly. Reach out to your family and friend when times get hard. Don't worry about if they're talking about you or how they're feeling about you. Our families are so broken these days. And I find that to be more with depression as well, too. You can't go and talk to your family member because they have put a stigma on mental health, and they're either calling you crazy or we know something been wrong with them. Or, she ain't always been right in her mind. You just don't know who to talk to. And in the African-American community, we always was told to go pray about it. Well, I found out as I got older that God doesn't only allow us to go and pray about it, but he also allows us to be able to go to people that he didn't put in place for us to go and get help from, and also pray too. And I always tell people now, and I have it posted up in my office, you can have God and a therapist too, because he put me in this position to help you. So reach out to your family members and friends when it's time to get hard, if you have those people. If not, there are support groups for people with diabetes and depression. And you can go online if you're not a person that don't like to be in a crowd of people. And of course, with the pandemic, that is not very doable these days. So most things are online, but there are support groups. Get regular medical checkups and see your provider if you don't feel right. Get help if you think you're depressed. If you wait, it could get worse. So there's diabetes and anxiety. Oh, wow. The pandemic and already brought us all the anxiety that we will ever need, trying to work together a balance of working from home with my private practice, with my other 2 jobs, and then having a 10-year-old that's doing virtual learning, and then trying to help care for my mom that has diabetes, that lives way in Arkansas and in Oklahoma, because she's back and forth all the time. So anxiety is at an all-time high. Diabetes and anxiety, people with diabetes have nearly twice the rate of diagnosed mental illness as those without diabetes. 40% of people with diabetes also exhibit elevated symptoms of anxiety. People living with diabetes often experience significant emotional stress, which can negatively affect an individual's mental health. There are signs and symptoms of anxiety. And we all have experienced these. I was experiencing some of them before I even got on here to speak today. And what we need to know about anxiety, their emotional symptoms are feelings of dread. Like feelings of dread would be an example of, oh, I really don't want to do that, but I gotta do it, because if I don't do it, then I'm gonna have to go and pay this, or I ain't gonna pay this on time, or this gonna get shut off. Trouble concentrating, just can't focus on things. Feeling tense and jumpy, fearful, just afraid. and don't know of the future. You may be afraid of the future, of things that might happen, concerns that you can't have, that you're having, that you don't have any control over. Anticipating the worst situation, not looking at the possibility that it could go good. Instead, we're always looking at the bad. Irritability, being frustrated, walking on eggshells around people, not being able to be yourself, just feeling like you're less than, inadequate, restlessness, not able to sleep at night, laying awake worried about things or thinking about things, your mind not shutting off, watching for signs of danger. You're just thinking something is going to happen that's bad. You just know it's going to happen that's bad. Feelings of a blank mind, just going blank. Like, I don't even know what I was just thinking about right then. Like, well, where did that go? Where did that thought go? What was I thinking about? And you always hear us say, it'll come back to me later. It must not have been important. However, moving along, what can you do? Well, I have a lot of techniques for us to do. And me and my son, we do it all the time. Our main one is meditation. After the loss of my husband, I realized I had a lot of anxiety. And every time I seen somebody that had diabetes that was poorly managed, I would jump in and I would try to fix them. So that brought me a lot of anxiety myself. And because I just wanted everybody to be right and everybody to do right. But we all know that we can't make everybody do everything right. And I don't care how you talk to them till they blue in the face and how much you show them or tell them my story. And they're not going to do what they want to do until they want to do it. So what you can do is you can do slow breathing. You can do progressive muscle relaxation, and you can stay in the present moment. You can have a healthy lifestyle. You can take small acts of bravery. You can challenge your self-talk. You can plan worry time, and you can learn from others and be kind to yourself. So anxiety management strategies. These are a range of strategies you can try to manage your anxiety with. What works is different for everybody. And it can take time to find the strategies that work best for you. But remember, if your anxiety is proving difficult to manage, you seek somebody for professional help. So with those 10 strategies, I want to practice some of them with you because I do these with my clients when they come in with me, especially the ones that have been newly diagnosed with diabetes. They're pretty much don't know what to do. They're overwhelmed by all of the information and the material that they didn't receive. Pretty much their doctors tell them. And that's why I collaborate with different medical clinics and doctors now, because they do need to have diabetes educators there on staff. They do need to have mental health people there on staff when they're giving these diagnoses. Because you're sending us away with all this information, and some of us don't have the education and the knowledge to comprehend what you just told us. All I heard that you told me that I got diabetes sugar and I'm gonna die if I don't get this medicine today from Kroger. That's all I heard from you, and I know I don't got my check yet. So that is all I heard. And I'm trying to figure out how I'm gonna get this medicine. So when they come in, I address those complexities. I address those concerns, those distressors. And what I do is I go to the slow breathing part of it. And whoever they are, Mr. or Mrs., I ask you, I say, let's start a slow breathing. Take a seat. And the first thing I say, you're feeling anxious. Your breathing became faster. It's shallow now. So I want you to deliberately slow down your breathing. I want you to count to 3. And as you breathe in slowly, I want you to continue counting to 3. And then count to 3 as you breathe out slowly. It usually works the first time. But some I have to, they're very, very, very up there when they come in. And because they didn't dealt with it over a course of 2 weeks, because the doctor then gave them the diagnosis of having diabetes, and then it took them probably about 2 weeks to get in with me, because now they think they're losing their mind or something, going on with them. Instead, it's anxiety. And so we go through that little test of calming them down, and then we go through the progression of muscle relaxation. While they're sitting down, I said, you're going to find a quiet location within your mind. That means I'm going to have you to close your eyes and slowly tense and relax each of your muscles groups from your toe to your head. That means you letting go of everything. If your toes are balled up in your shoes, I ask you to just let them out. Plant your feet on the floor flatly. Put your hands on the table or in your lap, or let them hang down to your side. And I ask you to hold the tension for 3 seconds and then release it very, very quickly. This can help reduce the feelings of muscle tension that often comes with anxiety. Because with anxiety, you start getting headaches. You start feeling hot. You start getting sweaty. Your hands are sweaty. You just feel discomfort all over your body. You're feeling restless and irritated. Even sometimes anger. So the next one I do, I ask you to stay in the present moment. Anxiety can make your thoughts live in a terrible future that hasn't happened yet. Anxiety makes you think that everything is happening now and it has to happen right now. And so I try to bring you back to where you are. And usually I do, and I was going to do that today, but I was like, that's too long. But a meditation with them where I allow them to take themselves to the place that brought them the anxiety, which might have been that doctor saying, you got diabetes, your numbers are high. That's what, and I would listen to Miss Forrest. I was like, she hit the nail on the head. The doctors don't never give us the number and tell us what the number is. All they say is your blood sugar is high. You are diabetic. And then you don't even know which one you are, type 1 or type 2, until you get to the diabetes educator that tells you the difference. So then you're left driving home. I got to find a diabetes class and insurance ain't paying for it because Medicare don't pay for that. How do I do that? And so what I did for my own practice is that I offer a diabetes class. And I only charge $30 for it. And I start it over every month because I know insurance doesn't pay for it. I know there's nobody there to educate that has my training in mental health and all the things that they're feeling. And also know the equipment and stuff that you need to use. You need that in a one-shop place. But like I said, we're hopefully, bringing everything together. More of our doctors and mental health people are going to get together and collaborate and work together to provide optimum care for people with diabetes. So hope that'll get better for us in the future. So the next thing we do is in healthy lifestyle is keeping active and eating well. I encourage my clients and people with diabetes to stay active, eat well, going outside. Sunlight does something to you. You can be in a house. The house will drain you. Go outside. When you're feeling bad, you didn't check your blood sugar and you just ain't got a hold of it yet, because it's kind of trial and error when you become a new diabetic. Because you get up and you check your blood sugar, you're doing it 3 times a day as they told you to do. And then you go and eat something and you wait for 2 hours and check it again and your blood sugar is still high. And you're like, what did I eat that was wrong? That's trial and error right there. So after that is over, you go ahead and go outside. Go take you a walk. Get you a glass of water. Go relax, rest. Watch your favorite soap opera. But come back 2 hours later and check it again before you eat to see where it is. So if you plan on eating that leftover that you already had ate that early that morning, something in that meal before did not work for you for that blood sugar that made it high. So now you need to go and adjust some things or take some things out. So your blood sugar won't be high like that the next time you take it. So now something in your meal is making your blood sugar increase that way. And that I cannot eat that, or I can't eat that much of that, or I need to start decreasing it or cooking it in a different way. The next thing that we do is take small acts of bravery. That's part of kind of like avoiding what makes you feel anxious, right? Provide some relief in short term, but it can make you more anxious in the long term. But try approaching something that makes you anxious, even in a small way. So that, say for instance, I'm going to just do a dog because I am terrified of dogs. So seeing a dog in the park on the green belt in Memphis that's really big, that's supposed to be in a small dog park when I'm over there with my grandchildren, scares me to death, brings me anxiety. I want to do the fight or flight, and pretty much I'm flighting because I'm running back to my car. And so that brings me a lot of anxiety. But what you can do is, and I challenge, I mean, to take a small act of bravery is, you could walk over if that owner is there and that dog is on a collar, you can ask that owner, can I pet your dog? Just to get that anxiety, that fear off of you. Something that I would probably never do, but that's something that could be done to release that anxiety, to show a small act of bravery that you're trying to get over that fear, that you're trying to calm yourself. So try approaching things that make you anxious in small steps. Challenge your self-talk. And when you challenge your self-talk, that means you pay attention to how you're saying things. I come from a very, very spiritual, religious family. However, I'm a spiritual being. I'm not a religious person. And the reason I say that is because I don't care what a religion a person is. I love people in general. I don't care who you are. And so I'm just spiritual that way. I believe in a higher power. I believe there is a God. And so I challenge my self-talk and other people's self-talk when they come in to see me, especially when they have diabetes. They say, I got diabetes and my blood sugar is this, and it's going to take this to get it down and to do this and do that. And I ain't going to remember all that stuff. And I'm actually quoting my sister now. I ain't going to remember to do all those things. That's too much. So you just going to, you just going to die. You know, I'm blunt with them. You're just gonna just let it go. You ain't gonna check your blood sugar, you ain't gonna do nothing. You know, I lost my husband today, right? Did you forget that? So then we'll go back to challenge your self-talk. Just say, hey, this is a lot that they're asking me to do to check my blood sugar in order for me to get it under control. And I don't understand how to do it. Can you help me? Or I'm going to do one thing at a time until I get used to doing it. It's pretty much called strength-based talking. Instead of us saying that I got diabetes, I'm a person with diabetes. Instead of saying I don't got no money for that, I'm a person that has a limited income. So we change the way that we say things and we put a positivity into it, because we can speak life and death over people. We can speak life and death into our health. And so I always use strength-based talking when it comes to diabetes and learning the different ropes, because I teach you how to read a food label in the store. I teach you how to prepare your meals. And actually, I have all my clients to bring a list of dishes that they have, like the ingredients that go into their food, their meals, their favorite dishes. Bring me your favorite dish, your favorite meal that you love to eat, and all the ingredients, write them down that you put in there. Most of my African-American people, we don't do that. We don't write nothing down. We just know we shaking seasoned salt and everything. We're doing that is we're not measuring too much, and then we just been doing it for years, so we know how much go in there. So that's a task for them in their cells. And I'm like, just get a simple meal there, bring it to me. And so we'll go over that meal. And I was like, I want you to continue eating that meal. You don't have to stop eating it, but we're going to change the way that you prepare it. And it's still going to be good for you. And you can still have this meal in moderation. So challenge your self-talk and the way you say things, the way you view things, and just make it a positive way. Stop putting so much doubt in what you're doing when it's coming to managing your health. Plan worry time. It's hard to stop worrying. Actually, I was told worrying is a sin entirely. So set aside some time to indulge in your worries. Even 10 minutes each evening, write them down. What you worried about? I'm worried about I ain't gonna be able to afford these strips. He didn't wrote me the prescription for it, but my insurance don't pay for these strips for this diabetes machine. I'm worried about this insulin. My insurance, Medicare is not gonna pay for that Humalog again. I ain't gonna be able to get that part of it. I'm on 70/30. I'm not gonna be able to do that. And so what other kind of ways I'm gonna be able to plan this out? Write that down. I can't afford my medication. I'm not gonna be able to buy part of this medication, or I'm gonna have to wait till the next paycheck to get this medication. Write them down and go over in your head. And then I always ask them, I said, after you write those down and write all the things down that worries you about having diabetes or managing your diabetes or things that you need to prevent your diabetes, that's bringing you stress and anxiety and sadness, I want you to now think about which one of these things can you control? What can you control? The ones you can control, there's nothing you can do about them. So those things you're going to cross out, and not only are you crossing them out on your paper, you're crossing them out in your worries. Now you done took that 10 minutes to do that. Now I need you to go back to being who you are. I need you to go back to, is it time to check my blood sugar now? Is it time for me to go take a walk? Should I get back to work? What are you supposed to be doing now? Go live your life. So the next thing is to learn from others, which I did a lot of, becoming a diabetes educator, becoming a lifestyle coach for a national prevention program, and also becoming a diabetes advocate, and even learning to get up and speak in front of people, because that was like one of my worst fears. I always talked a lot, but I wasn't talking about something that was important like that. So learning from others, talking with others who also experience anxiety or going through something similar to as having diabetes. Talk to other people that got diabetes. Don't talk to these people that got these myths about it, or this uncle that they knew that they never met that passed along before they did, that their mama told them about. Go and talk to an actual individual that is actually dealing with diabetes, that has type 1, type 2, or who have been diagnosed as pre-diabetic. Because in that way you can go either way. Get into a support group, join a lifestyle group that I also teach about diabetes management, about physical activity, and knowing the difference between physical activity and exercise. When people think about exercise, physical activity, thinking about they got to go do like lifting some weights, go running, and they got to go do something strenuous. That's what they think they have to do when you tell somebody that they need to exercise or do a physical activity. Physical activity could be anything from gardening. It could be doing laundry. It could be riding your stationary bike. It could be sitting in your recliner with some hand weights while you watch soap operas, drinking your coffee. Physical activity is anything that keep your body and your heart moving. And then eating healthy. You don't have to have a lot of money to eat healthy. There are a lot of foods that we have in our house that we take for granted, that we don't look at as meals. In my Native American race and culture, I know we used to always have turnip greens with the salt meat in it. And then my mom would, and dad would do like the boiled okra with the tomatoes and the onions in it on the side. I always thought it was boiled okra and onions and tomatoes on the side. But in my Native Indian culture, it's called goba. It's a whole vegetarian Indian dish. And so I had been eating healthy and didn't even know it. So the only thing I had to do was go around and change the meat that was in the greens. I was still eating healthy. Change the way you prepare things and still be able to eat in moderation in order to manage your diabetes and keeping your numbers under control. And the last thing is be kind to yourself. Remember that you are not your anxiety. And that goes also back to challenging your self-talk. Because you feel anxiety, that doesn't mean that you are anxiety. You're experiencing something that is bringing you fear, irritation, nervousness, doubt, uncertainties. You are not weak and you're not inferior. You're not less than anybody. You have a mental health condition and it's called anxiety. Diabetes distress. Now that's the thing that you get when in the first beginning, when the doctor says, I check your blood sugar and your hemoglobin A1C over the last 3 to 4 months, been running like this, and your blood sugar been 250 to 750 for the last 3 months, and we took the medium number in the middle, and you are type 1 diabetic and you insulin dependent, and now you can't have a CMG machine because you still got the flip phone and we don't work on that. So we do the diabetes distress and mental health, and it refers to the unique, often hidden emotional burdens and worries that are part of the spectrum of patient experience when managing a severe, demanding chronic disease like diabetes. High levels of diabetes distress are common. The prevalence is 18 to 35%, 18-month incidence, 34 to 48%, and persistent over time. They're distinct from clinical depression and are linkages with glycemic control and disease management. High levels of diabetes distress have been significantly associated with poor glycemic control, poor self-care, and low diabetes self-efficacy and poor quality of life, even after controlling for clinical depression.
Letitia, can you hear us?
There we go. Hello.
Okay, I unmuted you. I went in to check when I couldn't hear you. Okay.
I was like, what's that? Okay.
I made it to where you guys couldn't unmute yourselves to get rid of the background sound. I was like, I don't hear her. Okay, go ahead.
All right, thank you. All right, hold on. All right, let me go back. Sorry. All right, what you need to know about diabetes distress is signs and symptoms of diabetes distress. Feeling angry about diabetes and frustrated about the demands of managing it, worrying about not taking enough care of your diabetes, but not feeling motivated to change, avoiding going to appointments or checking your blood sugar, making unhealthy food choices regularly, feeling alone and isolated. All right, making unhealthy food choices regularly, feeling alone and isolated. We have touched on that, of course. That comes in with depression and anxiety, making good food choices. And those who have diabetes know the scenario far too well. You've been given a disease to manage, and it requires daily attention to aspects of life that never seem controllable, even before the diagnosis. In addition, these behaviors, you're expected to look as a number and you're judged by those numbers, and the success of managing your diabetes by getting those numbers under a certain point. So those are the symptoms that needed to be known for diabetes distress. And what you can do is acknowledge your feelings about it. It is normal to have feelings. Sometimes they are positive, sometimes they're negative. Talk with your diabetes care team. Getting help from your diabetes health care team, doctor, nurses, diabetes educators, psychologists, or social workers. It's important to treat diabetes distress. Get support. Talk with your family and friends and tell them how you have been feeling. Set realistic expectations for yourself. And there's a lot to do to manage your diabetes, which can be overwhelming. Take time to do things you enjoy and reward yourself. Give yourself a reward when you meet your goals. And that is concluding the end of my session for mental health and wellness as a mental health provider, and that specializes in diabetes. So of course, November is Diabetes Awareness Month, and I know we are doing everything we can in order to make sure that people are aware of what diabetes is, how to educate, treat, and prevent and manage the disease. And my resources, of course, is myself. If you're knowing anyone that is dealing with diabetes distress, depression, anxiety, and need a mental health provider that specializes in diabetes education and the complexities of diabetes, I am an American Diabetes Associated mental health provider. In the diabetes education program, I'm also a certified diabetes educator, and I'm also a lifestyle coach for the National Change Program, Lifestyle Change Program. And so diabetes mental health provider is me, and I thank you all for taking the time to listen to me and to allow me to present this presentation to you all today. And again, thank y'all.
Thank you so much. Thank you for sharing your story, for the unique perspective that you brought to everything. That was such valuable information. We've got a lot of positive comments that you can look through. And then we also had one question, if you don't mind answering it in the chat box. We had somebody ask how they could become a diabetes educator with nutrition and mental health focus. So if you don't mind to answer that for us in the chat box, I think that'll be some really good information.
Sure. So you just want to put it in the chat box, you said?
Yes, ma'am, please. Okay, Lester, I have asked to unmute you. Okay, I may have to ask again.
Can you hear me?
Oh, nope, I can hear you. Okay,
Great.
perfect.
Great.
Okay, let me get the screen started and
All
then.
right.
Thank you for joining us. Our next speaker is going to be Mr. Lester Gillespie, and I am going to share his PowerPoint for him. And Lester, whenever you're on, and I will move it right along.
I just say click. Okay, my name is Lester
Good.
Gillespie.
There we go.
Can you hear me?
Yes.
My name is Lester Gillespie, and I had the great privilege of being a diabetes educator and working with local churches. And it was new to me, but I loved it. Give you a little history. Can you all hear me? Okay.
We can hear you. It's just like it's really staticky. It's cutting in and out.
Oh man. What that is. Okay. I'm gonna go ahead and start back. Try this one more time.
Okay, that sounds clear. Are you
Great.
ready?
Okay. So today we're gonna talk about what you know, what you don't know about diabetes. Click. Can you hear me, Rhonda? There we go. And that's me. Diabetes statistics. I just wanted to share some statistics with you all. 34.2 million people have diabetes. That's 10.5% of the US population. 26.9 million people are diagnosed with this disease. 7.3 million people are undiagnosed. So there's people walking around not even realizing that they have diabetes. And when they go undiagnosed, the longer they go undiagnosed, the more harm that it does to the body. 88 million people aged 18 and older have been diagnosed with prediabetes. Now, when you go to a doctor and he said that you have prediabetes, you pretty much can do something about it at that time by watching what you eat and also exercise and get proper rest. And those things can contribute to you not becoming diabetes if you do those things. Okay, next. Next. Okay, now I just want to get down to the nitty gritty of it all. You know, I work with a great deal of churches doing the power prevention program. And so I just wanted to start out by saying that we are very fortunate to have a great deal of minority churches in our region. The churches are the cornerstone for African American communities, and in most cases, they are where information is distributed. We know a lot of things take place at church. For some people, that's where they get their socialization at. Also getting the word. But the main thing is they have infrastructure within churches stronger sometimes than in the community. So they already have a great sense of order and making sure that each and every individual within that church know how to follow order, so to speak. So churches has given a distinct voice in the education in diabetes. The importance of knowing your A1C and the harmful effects of diabetes. I have found that pastors who attend the classes have a much higher attendance rate than those pastors who didn't attend. And so, as we come up with strategies and how do we get these churches involved, my first course of action is to recruit the pastor and the first lady. If you get those two individuals involved, people will follow. Also, it's important that before you get ready to start your classes, that you have flyers with the church name. Everybody wants to see their church name highlighted. And so that makes a difference when the sign-in sheet comes around, because they want to make sure that they get involved with their church activities. And so you have people that sign up. And then the other part of it is let the pastor be involved during your classes, because this is who they listen to on Wednesday nights, on Sundays, BTU meetings, and things of that sort. So this is why that's important, is to let the pastor help you with the flow of your classes. And then also, what I really like doing is I like to have icebreakers to connect everyone. And what that does for me as a instructor, it allows me to watch my classes start bonding. And when they start bonding, they become accountable to each other. And so I know I'm gonna have a well-attended class once that class starts bonding. Also, please do not give fake answers. If you do not have an answer that is being asked of you, make it a team sport. Have the whole entire group find the answer as a group. And then what that does, that empowers them. And once they find out whatever the question they asked is, they feel more empowered because they came up with it themselves. And then also, in the very beginning, and I should have had this at number 1, let your group make the ground rules. So sometimes we have to step up and sometimes we have to step back. We don't want one person doing all of the talking and speaking, and then others don't have an opportunity to participate. So it's very important to let everyone's voice be heard. So that's one of the ground rules that always keep coming up in our classes. And so that's the one that I really, really pay attention to, because I do want the participation from the people who have attended the classes. Okay, next. These are pictures of the groups that I done the classes at. And so I was very, very fortunate to have classes. And I wanted to make sure that each and every one of them felt good about coming to class and also felt good about being in class. And so I had to come up with some creative ways so that I could get their attention And so I use a thing called winning. And every time I said the word winning, what would happen is they would get up and they would do 4 or 5 exercises by walking around in the room. And also we had dumbbells. So we would just start marching, and you get all the giggling and the laughing and the talking. And then we would sit back down, and then everybody is in good spirits and feel good about this smoother. So I 3 or 4 times throughout the classes, each class, have them get up and walk around so that they may feel, when they hear that word winning, they know what happens. We got to get up and move. Our bodies is made to move. Our bodies is not made to sit on the couch. Our bodies is not made to be in one position. So I stress that with them because that's important to keep themselves occupied and also in shape. Okay, next. Okay, and here's also some other classes that I had. But also, I also do assignments with the class. I have them do in-class assignments. So I go out and with some nutritional labels, and we would go over them. So I would tell them when it comes to the serving size, that's the big thing. The serving, you know, a 8-ounce cup, you know, that's probably pretty equal to a serving in most cases. If you eat that whole bag of chips, that's not one serving. That's multiple serving. And so we go over there pretty much so that we all get a great understanding about how to read nutritional labels, how to read the sodium, the sugar intake, and the whole 9 yards. And then from there, I just go over to talking about the daily calorie intake, you know, for women 2,000, men 2,500. So I just build from that standpoint. But I also I allow them to be able to come up with different exercises on their own. You know, come up that you think that you can do. Now, as you can tell, in most of our classes, we have a variety of people in there, and therefore we have young. I don't expect someone 60 years old or 65 to do what an 18-year-old is doing or a 21-year-old is doing. Now, don't get me wrong. Some of those 60-year-olds will get down and get busy and show them young exercises. So that really makes my heart feel good when I see they're already motivated even at that age. Then I also talk to them, then they do an assignment on what does A1C mean. So I go over with the A1C, but then I go a little step further. When you go to the doctor and you do your lab work, that is definitely the time to get a better understanding of what A1C is. And so I will cover that a little later in my presentation. We talked about the daily calories, and then what does double trouble mean? I think Ms. Harris did a beautiful job with that, talking about depression and how it affects, how your diabetes affects your attitude. So I'm not gonna go over that too much. And Ms. Harris, you did a beautiful job. What are some of the ways to eat healthy while on vacation? That is another one that I enjoy talking to the group about, because they feel like they got to eat on the road as if they got to go to McDonald's and order food with high calories. And so we talk about packing some lunches. We talk about eating healthy while you're on vacation and while you're traveling to where you're going. So that is also important to make sure they understand that just because you're on vacation, you still have to watch what you're eating. Okay, next. Okay, and then of course we go over what is diabetes. And so we know that there's 3 types of diabetes. There's type 1 that usually occur with young adults. It's always treated with insulin. And then type 2, this usually occurs in older adults, although it's becoming more common in children and teens. And then we got gestational diabetes, and this only occurs with pregnancy. It's usually controlled with a meal plan and exercise. And if medication is needed, only insulin may be used. And then, of course, pre-diabetes, a condition in which blood sugar levels are higher than normal, but not high enough for the person to be diagnosed with diabetes. And like I said earlier, in most cases, exercise, proper eating, you can get your blood sugar down to where you don't roll over into type 2. Okay, next. Okay, diabetes and depression. Diabetes and depression seem to hang out with each other far too often. When these two are together, it is difficult to find the energy to do anything. Healthcare officials who work with people who have diabetes know they are far more. And again, Ms. Harris did a beautiful job in explaining it, breaking it down to the lower denominator, so I don't have to do too much explaining as it relates to diabetes and depression. Feeling of worthlessness, guilt, excessive sadness, problems getting to sleep or sleeping much, weight loss or weight gain, feeling restless or slowed down, thoughts of suicide, and loss of interest in usual activities. Okay, next. Okay, so I think you went over, but this is good. Okay, so we know, let's look at our A1C blood glucose levels. So we know that if we try to get that 6.0 and lower, but we know 7, we tipping the scale a little bit, but when you start getting up there in that 13, that red zone, yeah, then you having problems. And when you get there, that's when you start having problems with the blood flow, with the tingling toes, the tingling fingers. All of those things allow you to know that, hey, it's something going wrong, and this is not normal. So those are indicators letting you know that your blood glucose is high. Okay, and then your vision also is affected, and so that's important that you pay attention to that, and making sure that you because there's a 2-hour window for spikes after you eat, so you have to stay consistently on top of that. Okay, next.
Do you want me to try to go back?
No, it's pretty much saying the same thing as
Okay.
your A1C. Okay.
I tried to go back and it just kept going forward.
No, that's fine. You're fine.
Okay, there we go.
All right. Okay. You can live a long, healthy life, even if you have any type of these diabetes. The most important thing is to maintain a good A1C. Check your blood sugars daily, eat healthy meals and exercise. Living with diabetes is doable, but you must put the work in to stay healthy and keep your diabetes under control. And I just want to say this before I close. One of the things that was exciting about the classes that I taught was we would have graduations right after the completion of the classes. And so what I would do is I would kind of pre-prep them to take a subject matter, and then once we get to the end, I will have them all line up in a chair, and they will all give a presentation on the curriculum, the power prevention curriculum. And it made me so proud each time that they would get up there, and some of them would be shy. They wouldn't want to speak in front of people. But what made the big difference is that they had each other, and they supported each other in that program. And so when one went, the next one would go, the next one would go, and then they would all support each other, clap for each other, and make each other feel as if that they did it, which they did do a great job. But sometimes getting encouraged by your peers means a great deal, and getting the hand claps and the things of that sort makes the program work, because I know they got it then. When they are able to get up in front of a crowd of people and talk about what they have learned in that program, that lets me know that they got it. And so that's what we want them to be able to leave there with, lead the program with the understanding of what diabetes is and how it impacts one's life. And we can live a long life with diabetes. And I would like to thank you all for being a part of this workshop. It has been a pleasure in working with Rhonda, MBRC, and all the other educators that taught these classes in our region. So I was just excited to be a part of a bigger team. And I thank you all so much for letting me spend this time with you all, and enjoy the rest of the workshop. Thank you.
Thank you so much, Lester. We were happy to have him on here today. I know I mentioned earlier, but we did have the opportunity to complete 32 8-week classes within the faith-based community, and Lester played a big role in that. He was one of the community health workers out in the community facilitating classes, and getting to be a part of the graduations and go and watch. It was a really great experience. So thank you, Lester, for everything you've done.
Okay, you're welcome.
Okay, I'm going to stop this, and then Mark, I'm going to ask you to unmute. Did you get a thing? Yay, okay, you're unmuted. Okay, let me pull up your PowerPoint. Maybe.
Can you hear me?
Okay, I can hear you, and I'm pulling up your PowerPoint, and we'll get it shared.
All right, all right.
Thank you for joining us today. Nice to officially meet you.
Yeah, you know, most people do, you know, it's a line.
Yeah. Oh. Hold on, I'm looking for my buttons here. What's it doing to me? Oh, there we go. There it is. Okay, can you see it, Mark?
Okay, I see it now.
Okay, perfect. You're a little quiet.
I'm a little quiet. Do I need to be loud?
The sound.
How that sound? That sound better?
Hey, that's better. Yeah.
Okay, all right. Because I want everybody to hear what I got to say, because you know, we don't get a chance to get the kind of information that we need to understand the nature of what we're going through. You know, whether it's fitness, whether it's, you know, eating healthy, you know, but at this point, it's a good time because everybody is able to come together and share information that's going to help one another. So I'm here at Fresh Start, and we have an opportunity for people to come in and get the kind of information they need with health as well as with, you know, fitness. And me doing this for so long that, you know, I started out as just a regular trainer, end up with 5 national certification. And one of those things that it helped me to understand was becoming a PTC, and that's a personal trainer counselor. So I had to literally sit down with people and their families, whether it was adults, kids, and get them to understand the nature of what they was about to go through. Because when it comes to health and eating right, oh yeah, you're going to go on a trip, but it's only an effective trip if you stick to the plan. Okay, so next get Rhonda, please. Okay, so these are just a list of my certifications. So what happened was that I didn't just wanted to be a regular trainer. I wanted to add to just being a better trainer. And as you can see, exercise therapy, fitness, nutrition, group fitness, strength and conditioning. These certification helps me to understand the nature of overall fitness. So when people come in with different kind of, you know, illnesses or I'm not going to say, well, I'm not going to say that, but I'm just going to say that anything that was challenging to a person when it came to being active, we found a way to get through it and find a way to where they could put this active activity into their life. So you know what? They could become better, okay? And you're going to find out more about these certifications throughout the skids, okay? So next skid, please, Rhonda. Okay, so extending your health and wellness at home. This is where we all know it begins. We know we learn everything from at home. When your children see how you interact with them when it comes to cooking, when it comes to activity, they might be a little, you know what, not into it, but when they see how you are into it, that makes them say, my parents is like that. So I really have nothing to say. I have to, they got a choice. We have to give them choices. But we know what the best choice is for them. So we show them the kind of choices that they need in their life to make them, you know what, stronger, to make them to be healthier, to be more active. And yeah, it starts with us. And if we say that, you know what, where they can learn it at school, they can, but it starts at home. How many of children, our kids, look up to us first, being at home? So that's something we have to think about. When we're doing these things with our children, this is a way of us becoming, you know what, something in their life that not just being a parent, but something else. And you'll find out that too as well throughout the other skids. All right, next skid, please, Rhonda. Okay, so talking with your family doctor. And you know what, this being, you know, diabetes month, this is one of the reasons why we want to have a relationship with our family doctor. When you bring your children in to the office to see the doctor, what's the first thing they do? Oh yeah, they're nervous. But guess what? You're going to use everything in your power to get your children to understand that, hey, this is serious, not just for me, but for you too. But having that kind of relationship with your doctor, that lets them know that, you know what, I care, I love you, and I want to make sure you're in the best of care. And so your doctor's going to feel that same way too. The doctor's going to make sure they're doing everything to make sure that we prevent any kind of illnesses, any kind of health issues. And if it's unpreventable, then guess what? We're going to learn how to live with them better. And that's what we want to do. If we can't cure it, then let's find a way to live with it better. And in some cases, that's all we can do. And having fitness and eating right, we don't have to have a total lifestyle of fitness, a total lifestyle of eating healthy, because guess what? It's impossible because we have taste buds, right? So we're going to want to eat what we want, but guess what? There's a flip side to it. It's got to have balance. So if I'm going to eat some unhealthy, I'm going to have to do some exercises too, you know, and eat some healthy foods, because this is the only way we're going to be able to balance the kind of, you know, lifestyle that isn't just totally 100% perfect when it comes to health. And as a fitness instructor, I already know that, you know what, we're not perfect, and it's not going to be 100% right. So guess what though? We got all the tools that we need to keep ourselves balanced, okay? So next skid, please, Rhonda. Be a role model. Everybody that's on this that's watching are role models. And the reason why I say that is because we want to take the initiative to do something that's right, to do something better than what we normally been doing. But being a role model, being positive, being uplifted, showing people that, you know what, I want to be better than what I was yesterday. These are being a role model also sets in your child's mind, wow, can I be like my father? Can I be like my mother? Can I be like any of my relatives that's showing that, you know what, they're role models? Being a role model, is it hard? Sometimes I just have to, I can't lie. Yeah, I think it is. Because you know what, you don't put yourself, we don't put ourselves on a pedestal that, you know, we have to have people look up to us. Can you keep that up? Is it something that you want to keep up? But of course, because you are setting people, you are making people feel different. You're making people see something that, you know what, I can do that too, because I'm human. Why can't I do it? But the thing about it is when you have people looking up to you, you are a role model. And guess where it starts at? It starts at home, because you set the trend for your kids to become the same way. Decent human beings. Okay, and that's where it all start out, is at home. And if the leadership isn't in you to be a role model, then you know what, then it's a problem. But like I said, we're not perfect, but it's something that we want to have when we have to lead. So not just our children, but it could be even at work. Looking up, being looked up to, is that something that I would want? Of course. Because if I can help somebody in any kind of way to make them feel like, you know what, I can be better than I was yesterday, I want to do it. Okay. So next kid, please, Rhonda. Involving the whole family. Now, you know, this is a challenge because, you know, our kids can have set in their mind that, you know, I'm not just doing this today. But guess what? Do they have a choice? Not when it comes to, you know what, living a long lifestyle of being healthy and fit. You don't have a choice. So we're going to do this. But guess what? Choose an exercise that will work for everyone, children and adults alike. Is it possible? Oh yeah, it's of course. Even if it's just walking, if it's just, you know what, standing around doing some lateral raises, if it's just walking high in one place, high stepping, something just to get started. And this is where it all starts at again, at home. Focus on fun, but be sure that the activities are effective. That is, see, and this is one of the things I could never stress enough when I was a fitness director. You can sit on a bike and you can walk starting out, and you can lose weight, drop those calories, and feel good. But guess what? Your body is so unique that it will adapt to it. And when it adapts to it, you're going to have to step it up. You're going to make it more challenging. Do it means I have to lift heavy weights? No, of course not. So say like if you was walking a mile, you're going to have to walk. Let's try a mile and a half. If you were standing in one place doing high stepping, if you did 100 of those, you want to do 110 more. See, that's because your body when and that's the thing. It's so the body, I can never stress it enough. It's just that unique. And that's why we live these long lives the way we do, because when you put it in a condition that is built to, you know what, walk a long way, to run a long way, lift weights, it adapts. And when it does that, oh yeah, that means you have to turn it up. Never bring weight into a conversation about healthy eating. The best example I could give about that, you're excited about having a new meal plan. You're excited about exercising. And you got everybody into it. Everybody's excited. And all of a sudden, oh, well, you know what? I'm down because I'm overweight. Now you done destroyed everybody's mood. You never want to bring that into it. Just keep it high level. Keep it at a point. Keep it at a level where, you know what, we're all going to do this together. We're going to see these differences. We're all on the same page. And guess what? Everybody's going to love it and is going to be happy and just see a whole new you, whether it's the kids and whether it's you. And trust me, one thing you have to understand is that anytime you do fitness and eat well with it, it does something to your heart. It does something to your brain. It does something to your bones. And best of all, it does something to your attitude, and everybody will see that. Okay? Next kid, please, Rhonda. All right, there are points of having meals and varieties and choices. Here's where you get the kids involved. Here's where everybody gets to interact with each other and understand each other's likes, dislikes, and whether it is a dislike, show them that, you know what, even though it's a dislike, we're going to figure out what we can to make it a like, okay? Serve a variety of healthy foods and snacks. Snacks where, you know what, we think of an oatmeal cookie as being bad. Is it really bad? Think about it. Oatmeal. It's how you make the oatmeal cookie that makes it bad, right? Well, it's nothing a lot wrong with baking a healthy oatmeal cookie. It's just what you put in it. So if you put anything different in it besides, you know what, raisins, it can go lean that way, but depending on how many you eat too, okay? Try new things. Don't get stuck into a rut with eating the same old thing. Why? Because guess what? If you just ate chicken breast all week long, why wouldn't you just say, well, you know what? If this is all I can eat, then you know what? I don't want to have. I'm done. You know, and that's the human way about us. But we always find different meals to come up with to keep, you know what, the meals interesting. Okay, if they try something and don't like it, try again. There you go. Try. You do not have to say, and you say, well, you know what? I tried different things. I just can't figure out how to pick out, you know, a healthy meal. Oh, guess what? They do have, you know, apps that you can go online and look into that has healthy meals. Now, if you understand or know a little bit about cooking, everything don't have, if you cook fried chicken, here's a trick to it. Now, I don't share this a lot. If you do fix fried chicken, take the skin off of it. Oh, Mark, but that's the best part. Oh, well, guess what? You got your fried chicken, you just ain't gonna have, you ain't gonna have the skin. You see what I'm saying? So mentally, what am I doing to myself? I'm training my body to get used to doing something that it never done before. And that's what's hard about having taste buds and eating the way we have for years. But it works. You don't have to do it every day, every time you have fried chicken, but give yourself a treat. This is a treat. If you ate healthy 6 days all week long, take that one day. Do I gorge? No, because it ain't gonna happen. Because why? What you done did to yourself is made yourself feel like, you know what, I've been eating healthy this long. I've been losing some weight. I've been feeling good with exercising. Why would I want to go back and mess all that up mentally? All right. All right. Having regular family meals will help with talking about nutrition. Everyone eating the same thing, make it easier to get into a routine with healthy foods. And that's the truth. And that's the bottom line. That's what's going to happen. Your kids will bring it to your attention when you have something different. When you want to bring something different to the table, when it's not a cheat day, they're like, what's going on? We got a plan. We got a goal. We have to stick to this because actually you started it and they're going to stick to it, vice versa. And that's how you get to see your family in a way that, you know what, you can love what you're doing for them, love what they're doing for you, because now y'all are interacting in a way where, you know what, it's a family thing. Okay. Next kid, please, Rhonda. All right, I'm gonna end it with this. It's healthy food choices. Now, how do I get my children to feel like they're involved? You make out a list. Put all healthy foods on there. Don't put no snacks, nothing bad on there. You make out a list and tell them, okay, pick one of these items out of each group and we're gonna make something out of it. I don't care what it is. And they're gonna look, and just to be able to be involved with something like that, they're gonna be excited. They're gonna be like, wow, I get to pick something out of each one of these and bring it to a meal. So all you're gonna have to do, you're gonna have to be like, you know what? I'm letting them do this, so I got to put it together. And you do, but it's not hard. It's not hard. You know why? Do it on a day where it could be a cheat meal. Do it and this is going to help torque their mind as well. You're going to find them being at school asking, we don't eat this at home. Same. This isn't healthy, but this is how you take such a fragile, unique mind and enhance it into something so unique that people will look up to them in a way like, wow, not just them, but their parents. See, because it all starts at home, right? Their parents. This is what being a family is. Teaching them, learning, giving them the opportunity to be involved in a way that, you know what, they have a say so. How many of us had that when we was coming up? Because it was just like, you're gonna eat this and that's it. But now they get a chance to look up to you in a way where they say, I get to have a say so about what we're going to eat tonight, or even if we have a snack. And when it comes to the fitness part, this much here is a big tool that you use. So when you're ready to bring the activities into play, you eating healthy, we're going to make a healthy body too. And when you get to see what it does for each other, oh my God. And I done seen it being in fitness for so long and watching how kids interact with their parents in a way that they feel like, you know what, I got your back. Let's go, Dad. Mom, let's go. And they're like, oh God, I got to do it because I'm the one that brought them here. And they're like, wow, where did this come from? See, if you don't unpeel the orange, you don't get to taste the orange. You know what I'm saying? If you don't paint the picture, you'll never get to see it. And that's what we're dealing with when we're dealing with children. Engaging in a way where you get to see them blossom like a flower. And when you blossom them like a flower, you're going to give them that, it's just giving them a chance. And doing all of this helps them to say, I get to pick, where you get to say, I'm going to fix it. And that's what it's really all about. So thank you. I want to thank you so much for having me on here, Rhonda, because we don't know enough. Okay. And we're never going to know enough. But if we get the chance to hear something that, you know what, that might change our lives, that's the purpose. So thank you so much.
Thank you so much for joining, and Beth, I can't even speak at this point, for joining us. That was great. I could feel the energy. It was awesome. And very good, very good. My daughter holds me accountable, so it's true. You don't tell them something unless you want them to turn around and tell you back at it. Okay, I am going to okay. I asked you to unmute, Rico. Okay, you're unmuted. Perfect. Mark, thank you again for joining us. I'm going to mute you. I don't see any questions, and I see that Lester joined the question, answered the question that he had. So thank you again. Okay, guys, we are going to run a few minutes over, but we are going to have Rico present next. And he is going to talk about the childhood wellness program with the Boot Hill Health Alliance program. And then I will give a couple closing remarks and we will be ready to close it out. Okay, can you see it, Rico?
Yeah, it's about to start. Yep.
Okay, perfect.
Thank you. Can everyone hear me okay?
It's a little staticky.
Can you hear me better now? Or is it still staticky?
Okay, I think it's better. Go ahead. I will stop you if it's not.
Oh, okay. Thanks, Rhonda. Hi.
Thank you.
I'm Tarico Johnson, and I'm the project director for our childhood wellness program. So the childhood wellness program is the official title, but I like to call the unofficial title is the family and the community wellness program. Because for our program to be successful, we have to have the entire family component. We talk to kids about eating healthy and exercising, but if the parent's not along with the ride, it doesn't really have that same bite. So everything we do, it's for the complete family. We also want the community involved. We like to talk to the community about, hey, if we're at a grocery store and we don't have fresh fruits and vegetables, we must start asking that. We don't just need hot Cheetos, we need fruits and vegetables as well. So we want to get the whole community involved in everything we do with the childhood wellness program. So that's what it's about. So like I said, it is the childhood wellness program, but the unofficial title is the family and the community wellness program. Next slide, Rhonda. So as of like with the actual adult diabetes program, the actual beginning of this grant was about African-American kids who were selected because of the health disparities in the communities that we serve. So we wanted to do something to address the health disparities that African-American kids have when it comes to with physical activity and obesity rates. So some of our goals were, we wanted to improve physical opportunity for children in our service area. We have certain areas in our region that kids have access to all different types of sports. But in other parts, they don't really have access to any. Then you have transportation issues. So we wanted to kind of be that bridge to make sure that every child has every opportunity to do, whether it's a football, or basketball, or just being a kid, just being able to go to the park and just be physically active. We also really wanted to encourage healthy food choices. As everyone said before, we know with diabetes and any other chronic diseases, one of the main causes is obesity. So we have to talk about eating healthy. We have to talk about exercising because this is just such a major component to healthy lifestyle. With us doing so much with kids, we knew that we had to address screen time, television and internet and cell phones. But what's so amazing about what we found out, I talked to middle school kids, I say, hey, how much do you guys watch television today? And they say, oh, Mr. Rico, maybe 5 minutes, maybe 10 minutes. You're like, man, that's good. I say, how long are you on your cell phone? 8 hours, 9 hours. How long are you playing your video games? 8 hours. Now I said, no, that's the exact same thing. Like we're still being stationary. We're not moving. We're not exercising. We're not doing anything. We're just sitting there. And they was like, oh, you're right. So it was the thing, like I'm not watching television, but I'm looking at my cell phone screen for 8 hours a day. I said, yeah. So, hey, as we said, maybe do more TikTok videos, do something, just be active. If you're gonna be on it, make it more active for you. So some of the services we do, we talk a lot about nutrition education. We always gonna talk about physical activity, but we wanted to be that community engagement component with our partners from the Housing Authority of Charleston, with Lester Gillespie and his group. Like, we all just work together to make it better for each and every child that we all serve. Next slide, please. So the Childhood Wellness Program, it is, like we said, we want to provide education and promotion using community health workers. So we have Pastor Hood with the Word of Faith. We have Lester and Preston Moore with the Housing Authority, the Fresh Start, Stella Consultant. We got Mark Young now doing a lot of physical activity with our kids. We try to just have someone doing a lot. We want to get our kids active as much as we possibly can. But we also wanted to do a little bit of like what the diabetes program did. We wanted to get into the faith-based community. So we have a program called the Traffic Light Eating. And it's just like you would think, go green mean go. It means something we want you to eat every day, fruits and vegetables. We also want you to do go activities, running, hopping, jumping. Those are go activities. We want people to understand what a slow is, a yellow, something you may want to eat once, twice a week, but not every day. Whoa is cupcakes. It's red. It's fried foods. It's things that we don't need to eat as much as we do. And if you eat it once or twice a month, that's fine. But if you eat it once or twice a week, that's not as good. That leads to obesity. That leads to certain problems that we're having. So we wanted to talk to kids about that, like, hey, this is how we're gonna do this. But we didn't want to just say this terminology to our kiddos, then our parents didn't understand it. So that's why we wanted to do the same training in churches, in some of our just like adult groups. So now if a kid come on and say, hey, Dad, that's a whoa food, it's not like, huh? You know, it's a cupcake. You shouldn't be eating it. So we hold everyone accountable. So moms understand it, dads, grandparents. So we just really want to make sure that everyone knew the terminology that we're using. And that's kind of what we do. And that's how we really work on everything we do each and every day. Next slide, please. And just like every other program that we on here that we know, COVID has really changed the things that we do. We're an outreach grant, and we do a lot of outreach. We was in every community we served. We was out Monday through Friday, sometimes on Saturdays and Sundays. I done did events with Lester on Saturday afternoon. I done did events at churches on Sunday evening. So this is what we was about. We was about making sure we're in a community, serving the community with the program we said we was gonna do. We was gonna do it. We in 5 counties. We're gonna be in all 5 counties. It didn't really matter. Was it 6 p.m. on a Tuesday, 9 a.m. on a Charleston family community day on a Saturday? So we was just out everywhere. But COVID came, so you couldn't go out as much. So we decided, hey, sometimes going back to old school worked just as well as new school. Of course, we want to put things on social media. We wanted to keep, putting new information on our website and things like that. We say, hey, how about we come up with a newsletter? So this newsletter, we can distribute it. We have Fresh Start. Because when the summer food program went along, we had over 300 some kids that they were serving, lunch. If they couldn't, you could drop it off at the home. We said, hey, let's put information in these bags so kids and their families can see ways to exercise, ways to keep fit, what's good food, what's good service. Same thing with one of our partners, the Word of Faith. The second Tuesday of each month, they do a food distribution giveaway. And they usually serve between 150 to 180 families. Now these families are not all in our program, but we was like, hey, let's give people in the community information that can help them. So we sent out packages that might talk about your sodium intake, drinking less sugary drinks, eating healthy, exercising, because we know all of that matter. That's that old school it still works today. Getting paper in people's hands, letting them see what you can do. And so that's what we decided to do with the newsletter. So as you see what we did the newsletter, page 2 is about Traffic Light Eating Program. So we wanted people to understand what the Traffic Light Program is about and what we're trying to accomplish. On there, we actually have a success story in the actual newsletter. This is one of the young ladies who was in one of our churches. She lost 12 pounds just by going through these classes. She just started changing, like everyone say, it's not this big change. She ate less this. She exercised a little bit more. She did this. And next thing you know, she saw that 12 pounds. And she was like, that 12 pounds was just a start. She motivated to do better. And she just one of few, different people who have the same stories, same as you hear with the adult diabetes program. It's just getting people motivated to take small steps, because small steps actually do lead to big changes. That's what we did. The childhood obesity fact, we wanted to put those in there. According to the CDC, 1 out of every 5 kids in America is dealing with obesity. Those are things that we have to address. Also, 76% of kids that's dealing with obesity become adults dealing with obesity. So these are things that we say, okay, we got to figure out how to get this message out there, work with families about, hey, that's why we need to exercise more. That's why we need to, eat healthy and things of that nature, because we know chronic diseases a lot of times leads from obesity. So we really want to get that down. And then, like with everyone else, number 6 on page 6, helping families deal with COVID. So we wanted to have an actual page in here showing people hotlines you can call, like the state of Missouri. This is a number you can call if you need someone to talk to about what you're feeling with stress, anxiety, anything with COVID. And just by happenstance, during the break, I walked down to the local store, and the cashier know me from what I do. She said, hey, my kids now, they're going to be out home for school because of COVID. I was like, wow. And what really touched me is that she said, it wasn't that they're going to be home for COVID for a couple of weeks, is that she's a single parent, she worked, and she doesn't have internet. So she says, how am I supposed to make sure my kids are actually, doing a lesson? And that's what we go through daily. Like, it's not just COVID as in just the actual pandemic. It's what our parents go through every day. I don't have internet, but my kids got schoolwork to do. How do I get this done? And then that creates stress and anxiety and depression, maybe in her, while she's trying to make sure her 10 and 12-year-old be able to get their school lesson. So COVID is affecting all of us. It's not just that we can't have, youth basketball and youth cheerleaders. We also got to make sure that our kids still doing their schoolwork. And that's tough when you don't have Wi-Fi, you don't have access to it. So that's how COVID is affecting everything we doing. Like I said, we was in person with everything we did. All the kids we served was in person. Now it all has to be virtual. It has to be, you have to find ways to still get the kids without being next to the kids. And that's a challenge that we face, just like I know with every other program. Next slide, please, Rhonda. As we finished up on the newsletter, one of the things that I think our agency has been talking about, and I'm pretty sure other agencies have been talking about for years, is like, let's create a resource manual. And this resource manual was not only was going to have things in a resource manual about where your local health departments were, but we put in this resource manual, it was going to have things about how much exercise kids should be doing, how much water kids should be drinking. So we wanted to have everything. And it's not just local. We got things in there for the American Diabetes Association number, because I know dealing with the communities that we serve, some of our people don't have access to the Wi-Fi. So you can't Google the American Diabetes Association number. You need something like this. It's a little small pocket book. This here right here. It's like 60 pages of information that you can have. And hey, if you need to look for a phone number, you can get it. And I think that's what we wanted to do. We wanted to make sure that, like I said, some of the old school thing, hey, get the information out to people. Of course, everything we doing, it will be on our website as well, but we wanted to make sure that, hey, we know some of our clients don't have access to the web, to internet. Let's make sure they can also have, a hard copy of it if they need it. That's why we wanted to do that. Next slide, please. Thank you. So just like every other program, you do want some successes. You hope to get some successes when you start. And I can tell you from with our partners, we really have had some tremendous successes. So we have provided education to over 1,800 kids and their family in this program history. This program is a 3-year program from 2018 to 2021. We was actually supposed to enroll 300 kids by May of 2021. As you look and see right there, we had over 1,500 kids enrolled as of November 13th, 2020. That is not just something I'm doing. It's because our partners like Lester Gillespie, Pastor Hood with Word of Faith, a lot of our Head Start programs, communities they just took off with it. Because you can't get 1,500 anything without the community. And it's just been truly, we just truly thankful that the partnerships that we have and the work that we all have done, because it's a lot of work going into recruiting and getting kids to, enroll to a program. Sometimes people say it's just kids, but you got to understand, each kid has a parent who has to fill out some paperwork to get them enrolled. And if you know parents, they don't want to fill out anything, like nothing. Some parents have 3 or 4 kids. That means they got to fill 3 or 4 enrollment packages. And we have got that because the community have bought in what we sell. I mean, it's literally a true story. I can't stress enough that the community really understand what we're doing, and they just follow. We have family fun nights. And on our family fun nights, we just have parents and kids, and we do a whole lot of activities, parents versus kids. Parents versus kids dodgeball. Both parents and kids like the dodgeball. You can hit your parent, or you can hit your kid with a ball. They love that. But that's just because the community just bought in so well, and we can't stress how much this program really works because of the community. So we thank every partner we have, and all 5 counties have really just been so supportive. Next slide, please. So as we said, we definitely wanted to improve physical activity opportunities for children in our service area. I love these pictures so much, in every picture we have, because this is not clip art. These are my kids. These are kids that I have seen. These are the pictures I take. I'm not a photographer, but these are mine. Like I know these kids. I've seen it. I was there. And the beautiful thing about these pictures are, you got Black kids, you got white kids. You just see kids having fun. They exercising, doing all the things that we all wanted to do at that age, and they love it. We got a parachute. They up under the parachute, and it's like the best time of their life. And it's so amazing to watch the kids as you talk to them about eating healthy. Like, these are 3 to 5-year-old kids you've seen on their first 3 pages. And I can ask them like, hey, what's a cupcake? And they know it's a woe food. They'll give me a thumbs down. Now they like cupcakes, but they know they can't eat cupcakes all the time. And, we just have so many success stories of this, the kids just doing some amazing things. This past February, I went to one of our centers, one of our Head Start centers where the kids are, and the center director said, hey, the cafeteria staff looking for you. I was like, okay. And I went and saw them. They was like, hey, you got our kids not wanting to drink anything but water. I was like, sweet. But, the cafeteria staff, they have milk, and they, each month you're supposed to say how many milks the kids drinking, but they would only drink water, because I talked to them so much about drinking water. And some of my kids might not drink water at home, but at least there, they was like, hey, Miss Rico said, water make me big and strong. And it was just like, it's small things like that, but it's truly what we get done in the program we do. And another component, just like with the adult diabetes program, the faith-based partners have been excellent. They have went over and beyond whatever we can think. We have from doing exercising to the actual, the picture you see in the middle, they decided to come up with their own stoplight. That wasn't something we gave them. They came up with it, and they teach the congregation about eating healthy and exercising and go slow, woe food. And I said, that's so awesome, the way they came and created their own. As like Lester said, when you give them you empower them to come up with things, you'll be amazed what they would come up with. And that's what they came up with. And I say that is so outstanding that they came up with the stoplight, and it's just how it goes. And we've really been blessed that people have really just took our program and just took it to another level. Next slide, please. So just like everything going forward, this is so amazing that I was on here, and Miss Letitia talked about, her late husband, because one of the things I wanted to talk about, one of the things that we stress a lot with father participation, not just being involved in sports league, we want them to be involved in everything we're doing. I talk to parents, I talk to dads, I talk to moms, I talk to grandparents about the importance to start having males attend doctors. We have to get our annual checkups. We have to. And sometimes it's not just for you, it's for your kids, it's for your grandkids. And I stress that to them, like, hey, I know it may be tough to think that you may be getting diagnosed with something, but hey, at least now your kid or your grandkid or your niece or nephew in 20 years from now can say, hey, I know I got a family history of diabetes. I got a family history of prostate cancer. That may save their life. That may be able to get them an early detection that if it does, that it can be caught early enough that they can be cured. So we have to put that out there. We have to talk to males, especially African-American males, about we must attend a doctor more. So many times in our case, we don't know our family history. So if you can't go to the doctor and say, I don't know my great-grandfather passed from, it's good to at least know moving forward what you dealing with or what your kids can be dealing with. And I think that's so important so we can cut back on some of these things, because when you go to the doctor, a lot of times they talk about diabetes, they talk about hypertension. Those are things that if you're African-American, they just automatically assume you fall in that. But they don't talk about, maybe, if you having some other type of cancer or have something else that may only be common in your family, it might not be common in every African-American family, just your family. Not just African-American, but anyone. And we have to get males to really take it serious about attending doctors, going and just being checked up, because you never know what it can save your life. You definitely can make sure that your kids and grandkids and nieces and nephews, at least they will have a history of what could be something that's going on with their family. So that's why we wanted to, we stress that to fathers, we stress that to moms, like, hey, get your husband and go get yourself tested. Just get checked out. And as Ms. Letitia said, the more you know, the better it is. I know as a 40-year-old man, I just had my annual and I asked my doctor, I said, hey, is it time for me to get my prostate checked? He was like, you know what? They have changed the number. I mean, the age now is more 45. But that's a question that I wanted to know. And it wasn't just, I just wanted to know. And I felt like this is what it is because I have 2 sons. I would like them to know if something wrong with dad, like this is something they need to look out for and they get 25 or 30 or something. Just like we preach to ladies about getting mammograms. So we have to preach to dads and males about going to their doctors and annual checkup and things so we know. June is National Men Health Month. Majority of the time, nobody ever tell you that. We all know October is breastfeeding awareness. We know it's breast cancer awareness. We know that. We know November is National Diabetes Awareness, but we definitely need to make sure everyone know that June is Male Health Month, because these are things that we need to get. It needs to be just as common as anything else, because that's what we need, because we can't have males, not getting tested and not going to the doctor, because that affects everyone. As I said, our program is for the whole entire family. So we want to continue to stress that for dads and anyone else, because you need to know your A1C. As Ms. Valda said, it's not okay for a doctor to tell you your A1C up. It's a little high this time. You just say, okay. We want to stop that. I used to work with the diabetes program. At every church and everybody I met, my thing was, we gonna stop the shake your head syndrome. We're gonna stop going to the doctor and just shaking our head, then walking out of there. I said, no, we're gonna ask questions. We're gonna know what our A1C is. We're gonna know what our blood pressure is. We're gonna know what our cholesterol is. We're gonna know we need to get our feet checked, because we need to do this if we're diabetic. We can't just keep being like in out. You don't need to be a diabetic and you're in the doctor for 10 minutes. Like, no, that's not acceptable. If we don't push it, if we don't promote it, it's gonna continue to be that way. So that's really what we try to do with everything. Everything I talk about, we try to stress this to everyone. It's not, like I said, it's Black parents, white parents, wherever I go, I say, hey, please go just get yourself checked out, because it can save your kids' life. And I know we all want to make sure our kids have a wonderful life. And we want to make sure that we take these numbers and when we do have this program one day, 90 to 95% of people with type 2 diabetes, that number can be down to 50%. We on this call know that type 2 diabetes is preventable. So I talk to parents about that. I talk to parents about, according to the American Diabetes Association, every year now, at least 5,000 kids are diagnosed with type 2 diabetes. We know type 2 diabetes is prevented. And if a child has type 2 diabetes, us as adults have to take most responsible for that, because we are failing our kids. We shouldn't have 5,000 kids with type 2 diabetes. We understand how type 1 works. We heard from the experts earlier today. A lot of that is nothing a kid can do about type 1 diabetes. But if you're a type 2 diabetic, that is on us as parents. That's on us as adults. We have to do better. We know the number 1 cause for amputation is diabetes. We know the number 1 cause for kidney disease is diabetes. So if we want a 12-year-old child to be dealing with doing amputation or being blind, that has to affect us. We can't allow that to be. Those numbers have to go down. And it's going to take each and every one of us to make sure those numbers do go down. And like I said, anything you guys can do to help us, my email is on here. Please pass it on. Any information, because we really want to just keep doing what we're doing. We want to get those numbers down. We want to do everything, but it takes all of us to do it. And that's pretty much all I got. So thank you guys so much. And thank y'all for just being here for this year diabetes workshop virtually. That's all I got.
Oh, there I am. I was trying to unmute myself. Okay. Thank you, Rico, so much for that. I always enjoy listening to you talk about the kids. They're so important. Let me see. Okay, I've just got a few comments that I'm going to make to wrap this up. You guys bear with me just one moment. Okay. Can you see that, Rico?
Yep.
Okay, I was just asking you because I knew you were unmuted. Okay, so I will have the evaluations sent out to everybody by 5 p.m. today. You will have until November 22nd to complete those evaluations. And then on the 23rd, we will draw a winner. We do like a randomized generator to select a winner, and whoever wins, they will be notified via email, and then we will send you your $100 gift card. On the 23rd, by 5 p.m., you guys will also receive a certificate of completion. And then also we will send you the recording to the workshop. You will have access to everybody's PowerPoints, any other information that we can give, like we can attach the newsletter from the Childhood Wellness Program. I made a few references during my presentation, so I can attach those as well so that you guys can see all of that information. And I know we had a question about the resource manual. So as Rico said, it will be printed, and then we will have that available also digitally. So that will be available on our website when it is finalized. I encourage everybody that wants to see anything additional to visit the MBRC website. We have each program on there, and we are constantly putting information on there. You can see more success stories, more pictures of the kiddos. My slideshow that didn't work earlier of all the graduates that we've had through the Power to Prevent classes. There's just an abundance of information, and not only just information, but real life stories of the individuals that we are working with and the impact that us as a community are having on their lives. With that being said, I do want to thank all of our partners again, everybody that joined the phone call. Without the collaboration with our partners or the participants in all the programs, our programs would not be successful. You guys all play such an important role in that, and we literally cannot thank you enough for everything that you do. So thank you so much. I am going to glance back through the comment section and make sure that we don't have any additional questions. Yes, Teresa, thank you so much. Teresa works with NHS, and she has been offering our virtual education through the diabetes program. Let's see what else we have on here. Okay, thank you guys all for the kind words. We really appreciate them. We love to be able to do this for the community and extend the abundance of information and make sure that it's available for everybody. Thank you again to our presenters. You guys were phenomenal. Let's see. If I have missed anybody's questions, please feel free to email me. Like Rico said, you guys have our contact information. Feel free to email me questions. We can get with the presenters if there's anything else that you want to know, or if there's just anything else that you would like to get from us also. We would be happy to help in any way possible. We do apologize for going over on the time, but there was so much information, we didn't want to cut it off. So thank you guys so much for joining us, and I think that wraps it up. So have a great rest of your day and a great weekend.